like to welcome you all to the Montezuma-Cortez RE-1 School District work session meeting. If we can call this meeting to order at 7 o'clock, and we will do the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Okay, do I hear a motion to set the agenda?
I make a motion to accept the agenda for the work session tonight.
I'll second.
Okay, motion by Stacy Hall, second by Cody Wells. And I just want to remind everybody, this is a work session, so there's no community comments at this meeting. We will have that at our regular board meeting on the 18th. Okay, discussion item number 4.
I think we need to
Call for the order.
call for the
Yeah,
question.
sorry.
Frazier,
Aye.
Hall,
Aye.
Hart,
Aye.
Noyes,
Aye.
Rice,
Aye.
Wells,
Aye.
Wright.
Aye.
Thank you.
You're always seeming to want that. I'm sorry. Okay, discussion item A, Laurel Schafer with the Healthy Kids Survey. Welcome.
Thank you. Thank you for having us.
Yes, thank you.
Okay. More of a conversationalist person, so I'll do my best here. So thank you again for inviting us to talk about this, this issue this evening. We understand from the last few board meetings that the Healthy Kids Colorado survey has been brought up. Our intention is to answer some questions and to do some education on the Healthy Kids Colorado survey. I do want to preface this conversation with the fact that we are also somewhat irritated and frustrated with the state for their lack of education about this topic. We've reached out to them and talked to them about this. That's a whole nother thing. So, but it is frustrating when they aren't doing, when we're doing their work basically for them. So I just want to say that. However, we do know the value of the information that is collected from the survey, and that's why we're here. We are advocating for this important data that represents the health of Montezuma County youth. This is the only comprehensive survey of the health and well-being of our young people in Montezuma County, and probably in several other counties across the state as well. It is anonymous and completely voluntary. I spend quite a bit of my time advocating for our community by ensuring that we're not always lumped into decisions that are not tailored for non-rural areas. I've spent the last 2 years doing that with COVID and making sure that we are represented well here and speaking out for the way that we do things differently here and how just because it works in the metro area doesn't mean it's going to work here. So we have to look at things differently. And when we don't have our own data, we lose our voices. They like to lump us together in regions. They like to, the state likes to, you know, this works for La Plata County. Why doesn't it work for you? Well, because it doesn't. We're not La Plata County. And we deal with that a lot when it comes to the data. We rely on regional data that may not properly represent our kids or our communities. We will be having to look at other options if we don't have our own data when it comes to this survey. And we'll go through the survey. I brought a sample survey, but I kind of wanted to give a little bit of history. So when we don't have our own data, we rely on what they call the Behavioral Risk Factor Surveillance System data, which is provided from the CDC. So maybe it represents us a little bit, but I mean, what is really in there? We also rely on health surveillance records, which are usually limited to students or youth who present in an ER. And at that point, we're in crisis mode. or that are lucky enough to get to doctor's visits regularly, which a lot of our students don't. So this is why we really feel like this data is really important. We're different, and we're different on purpose, and we choose to not be like Durango. We choose to not be like Metro Denver. So this data is really important. So anyway, as far as the survey goes, so it's administered every 2 years, and not every school, not every student, not every class gets it. It's randomized for privacy. So they will choose a school. They'll choose a school here. They may not choose every single class. My understanding though, and this is not official, but I've been told this several times, they always choose Montezuma County and Ignacio area because of the tribal relationships. And it's vital tribal information that they can't get anywhere else. Is that true? They don't really say a lot because it is private. So I don't even know which schools can and can't take it as a person who utilizes this data. I know if I want the data, I have to go to the school and ask for it. Not everyone can get this data. Not every person who walks in off the street has access to this. So we will know when we ask for it if they've taken it. So they choose a school, then they randomize through classes. So not every student, not every class takes this because they need to keep it private. And they usually do it in the fall semester because it has to be done before winter break. And again, it's every 2 years. There are 2 surveys that you can choose, and I believe that it's up to the principals of the schools to choose the surveys. There is a censored version and there is an uncensored version. I've looked at both of them on the website for Healthy Kids Colorado. Basically, it takes out the sexual questions in the censored version. So that's the only real difference. There's still some others. It's about 160 questions long. They've done several studies on it because there has always been concern about the length of the survey, but it takes an average of 30 minutes to complete for a student. And the student doesn't have to answer every question. They can skip. And if I could show you some of the recent from the 2019, I would, and I would welcome you to look for that with your principals, because you can see where students have skipped a certain section, and maybe several students have skipped a section. It's very specific. So the goal is that the school districts make sure that whatever classes are chosen, the parents are notified that this survey is happening, and then the parents have a choice. The families can have a choice whether or not they want to participate or not. So the schools ultimately, once it's all said and done, they own the data. There's a process for releasing it. It's called data sharing agreements. And again, not everybody can just grab that information and get it. You have to be some sort of an entity in prevention, health, anything along that lines, and it is up to the principals and school districts who they share it with. And if we don't specifically get the MCHS data or the Dolores or the Mangus, then again, we look at it regionally, what we do. So, and it does change. There's a few changes in looking at it regionally as far as looking at it at a specific school. So anyway, this is a sample. Healthy Kids Colorado came in 2017 and did a presentation on their 2017, so the data. So it kind of goes through here. These are the people that worked on it. It is also, just so you know, it is also overseen by the Colorado School of Public Health, the University of Anschutz, and Denver University. There's some tribal information on there. And again, this is the Montezuma County survey, so I'm not really sure exactly, it's all represented in here, but here it will tell us soon. It just kind of, this is a basic overview. Now, MCHS can go to their principal, they can look at exactly what the number of students that took the survey at MCHS and what the outcomes were. We'll get through all this. So in 2017, middle school students, grades 6 through 8, high school students 9 through 12, and 410 students participated. This tells you about the survey, and I think you all, I believe I sent this to every board member, so you do have this. It is a comprehensive survey. It is not just people doing their own surveys. These are trained professionals looking for this data. They know what they're looking for. They can figure out statistically how many kids are taking it seriously versus how many kids aren't. They account for that. So they adjust the numbers for that specific, because we all know, you know, kids are kids and maybe they don't want to take it. So, and the data is there to not just look at bad things. We're looking at protective factors. We're looking at health behaviors. We're looking at social emotional indicators. All of these are part of the survey. We have a program that uses the protective factors all the time. You know, that's where we got the statistic of 93% of kids who took the Healthy Kids Colorado survey in 2019 chose not to drive while drinking. We would never have known that. That was specific to our county. And I think that's worth bragging about. Some myths around the survey: students don't answer honestly. And the research shows that on anonymous survey, students answer just as honestly as adults would. And then they have ways to weed out inconsistencies. I couldn't tell you how they do it. I am not a data person. I simply utilize this to serve my community. And I have several other examples of other people that I've talked to, and I'll share that with you later, of who else uses it. That they're too sensitive in nature. The truth is this is an adult perception. During the pilot testing, students don't feel the questions are too personal, and know that it is anonymous, and that they can skip any questions that they don't want to answer. Again, I think some of this goes back to Healthy Kids Colorado educating our school leadership, like our principals and teachers, that, you know, if you put a survey in front of a kid that is willing to take it, great, but if there's a kid that doesn't want to take it, you shouldn't have to. You know, it's not being forced on anyone. Some questions will encourage students to partake in that behavior when they previously would not have. And research shows time and time again that that is just not. Asking questions doesn't change behaviors. In fact, talking about things and getting that stuff out actually helps relieve some of that internal stuff that maybe kids, you know, maybe they're reading this, they have nobody to talk to, but they realize this is on a survey. Maybe there's not anything wrong with me. Maybe I'm not the only one dealing with this. And again, schools are randomly selected, classrooms are then randomly selected, and it's aggregated to maintain the count. I have a whole calculation on how they do that. It takes me a few minutes to figure it out when I look at specific, so we won't get into all of that. So this is going to give you what the youth health in the US is during this survey time. So causes of death, obesity and mental health, substance use. The leading cause of death in the United States 12 to 19 was unintentional accidents, motor vehicle accidents, suicide and homicide. We deal with a lot of programs that are trying to reduce the suicide rate in our county. And the health department's not the only one. There's several other entities that are trying to figure out ways of getting stuff out there. We use this survey for our youth. National trend, 14.8% were obese. Mental health, 1 in 5 young people report having mental health problems, stress, etc. Suicide rates are increasing, 7.4% attempted suicide. This was in 2017. So I'd like to hope that things have gotten better, but I think the reality of that is the opposite. Substance use statistics. Again, alcohol. I know a lot of people always think that it's marijuana and other things, but alcohol is still our #1 killer of not just youth, but adults. So then they look at Colorado. So this is everybody in Colorado that took this. You know, in the end, they've got their stuff here, multiracial and LGBTQ students experience the highest rate of health disparities. Alcohol was the substance used at the highest rate among adolescents, and marijuana use was unchanged since 2013. I do think that was before marijuana was legalized. So I can definitely see shifting around in there, but and again, I don't have the 2019 presentation, and now my understanding is MCHS is the only school in our county that chose to take this survey, so we won't have that for the county. Takes in all the social determinants of health, your neighborhoods, your economic stability, your education, your social community context, health and healthcare. And again, you know, I go back to, I can use CDC data and I can use health survey risk factor data, but that's for kids that get to go to the doctor, get to do those things. So, you know, what this is just saying is it allows us to kind of look at where our community is going and where it has been, and be able to shift and change as needed. So active lifestyles in the built environment, there's some statistics here by grade, by race, attempted suicide. So there's the national rate, there's the Colorado rate, there it is by grade and by race. And again, you get this for your specific schools. By completing the survey, you own this data. Went hungry from lack of food in the past 30 days, by grade in Colorado, and then by grade. And so then here's the Montezuma County results. And so you've got your Colorado results, your Montezuma County results, and you've got your state or your national. So demographics. So we have a high number of our students that took that in high school and middle school. Oops, stop there. So then it gives you the demographics. And then these are some of the questions. So school connectedness. These are some of the behavioral health questions. So extracurricular. So extracurricular question was, so in Montezuma County, 61% participate versus 68% in Colorado. 76.5% reported that college is important to them in Montezuma County, but in Colorado, the state average is 89%. Their grades were mostly A's and B's, skipped skipped school, skipped one day in the past 4 weeks, we're a little bit higher there. This is middle school. So again, if middle school is taking it in high school. So Montezuma County Middle School versus Colorado, you know, they have someone to talk to if they're sad, hopeless, empty, angry, or anxious. So 78% of Montezuma County kids said, answered that, and have an adult to go to with a serious problem. So we're a little bit low on that, you know. And then this is high school. And here's some mental health statistics. Male, female, Colorado, Montezuma. So we can see that there were 33% that reported that they felt hopeless for 2 weeks or more. And it looks like maybe the females are feeling hopeless a little bit more than the males during this. So is there something that we can do? Is there something, you know, and speaking specifically to the schools, what does, you know, what do the counselors and the principals, are they talking about this sharing? This information can be used in many different ways internally. So let's see, considered suicide in Montezuma County, 19.2% had considered suicide, and the average for Colorado is 17. Middle school, 21% had considered suicide. This talks about bullying in Montezuma County totals versus the Colorado totals, whether they were bullied on school property, bullied electronically, or been in a fist fight before. If I were working in a school, I would want to know that. I think that'd be useful information. Middle school. So the middle school had a much higher of being bullied on the property than the high school. And again, this is countywide. We all have access to specific MCHS, CMS, Mancus high school, they have theirs, and everybody can look at this exact same data for their schools. So in Montezuma County, and carried a weapon on school property, 21.2% versus 4.4% in Colorado. Feel safe at high school. 54%, is that 54? 84% said they do, and the average in Colorado is 90. I think that's kind of a positive. I mean, I'm not saying that the other 15 or so % doesn't matter, and we could probably do something about that, but substance use in high school. So there's Montezuma totals and there's Colorado totals. So again, there's alcohol, we're a little bit higher, marijuana, we're a little bit higher, we're a lot higher. E-cigarettes, cigarettes, and pain meds without prescription. Again, I think this is pre-legalization of marijuana. Middle school, this one I found really interesting, was e-cigarettes. So you've got the alcohol, you've got the marijuana, you've got the cigarettes, pain meds without prescriptions versus the Colorado average. And again, they're getting those Colorado averages by all the other schools that are doing and tabulating that into the Colorado totals. And then these are questions that they ask students about substances. Are substances easy to get a hold of? So you've got your Montezuma High School and your Colorado high schools and your middle school and your Colorado. So, you know, we're a little bit, we're already in there. Physical activity. This one I liked. We do a lot of outdoor stuff here. We have a lot of farming. A lot of our kids do a lot of work, you know, so this might be a little bit hybrid. That might be why. Middle school. Nutrition. So, you know, things like eating breakfast in the past 7 days, ate fruit in the past 7 days, ate veggies in the past 7 days. And middle school. So then they go through on how they loop it all together. And again, this is out there for anybody who wants to look at it. Students who have higher grades and who have trusted adults in their lives are proven to less likely to be currently sexually active, less likely to drink alcohol before the age of 15, less likely to have ever used marijuana, involved in a physical fight, more likely to engage in physical activity. So this just goes on to how you can use the results to support your work. We do quite a bit of that along with other entities. This just goes on about all the other resources and people and this is a really, really high level. Again, like in each specific school, you can narrow it down, and there's 160 questions. So you can really look at that and see what's going on. So I did talk to a couple of people who come up earlier, and I just wanted to kind of share about who's using this. It's not just us. We do use this to improve our community health. I mean, our goal as public health is to educate and to prevent. And if we can do anything along those lines, we have several programs. We have our Communities of Care program that uses this information for positive youth development opportunities. The Pinion Project, I know, uses it. CNC, our suicide prevention program. I was able to, I'll talk about SCYC. So right now, SCYC is in 2 of your schools, 3 of your schools, MCHS, CMS, and SWOS. Okay. They have after school programming that they provide for students. They use this survey to get funding to be able to provide those programs. So,
Hello, everyone. My name is Arlena Yazzie. I know probably like 4 or 5 of you from here because I was raised into the school system. So thank you again for having us here this evening and giving us the opportunity to speak to you. There was a lot of information, so sorry about that. We've got some more that we're going to share. But I also agree with Laurel in expressing that we are here fighting for this, asking you guys to reconsider and to have it continue because it is so critical to our community to be able to provide those prevention services. And so with that, Laurel was mentioning the different organizations that utilize this information to get grant funding and to do strategic planning. So I reached out to the NEST, so our Four Corners Child Advocacy Center. I reached out to Rose directly and I asked her 2 questions. For what programs do you utilize the Healthy Kids Colorado survey data to procure grants? Wait, let me think. I didn't say that right. For what programs does Four Corners Child Advocacy Center written grants, which included local level data from the Healthy Kids Colorado survey? And she said that she uses Healthy Kids Colorado survey data for their government contract, which is for the overall victims program. So that's one program that includes advocacy, intervention, and therapy. And I would venture to guess that everyone here agrees that their services are critical and vital to this community and the youth that live in it. And then the other question I asked is, how is the Healthy Kids Colorado data important to your organization? She said that the data is important because they need to be able to justify their services. Prevalence of these programs must be demonstrated in our population. And so in taking away, and it's really unfortunate that our other school districts have already said no, because that's now 4 years if they ever consider adding it again or having it again. That's now 4 years that we are left in the dark about what our children are experiencing in and around in their lives. So it's 4 years in the dark. Well, we don't know, as people who provide direct services, as people who organize and bring together community partners, that we don't know how we can best serve our community. So it is a disservice to take away this one data source, the only data source like it in our community. And you have to think about the larger ecosystem of the community and who's utilizing this information. So I also reached out to the Opinion Project, and I'm sure we can all agree that the services they provide are really critical to our community. And it's not just youth services, it's family services as well. So Kelly Willis responded back. She said that she uses this data to apply for grants through the Office of Suicide Prevention, which supports the Youth Suicide Prevention Coordinator. I don't know this acronym, I'm sorry, it's TGYS grant, Office of Behavioral Health Grants, Caring for Colorado, High Fidelity Wraparound, and Collaborative Management Program. And that's a huge bulk of their programs that this data helps support, and then being able to procure grants and have them be more competitive in our community. And we can probably, again, all agree that our community has kind of a lack of funding and a lack of resources. So why would we want to take away this tool that can help us support our community? I also reached out to Lynn Urban with the United Way of Southwest Colorado, and how this data is used to support their work, and this data has been used to kind of guide their action teams, which if you've not heard of Team Up Southwest Colorado, they're doing a lot of work for our community's youth. So, and not only here, but in Dolores County as well. But we've got the Behavioral Health Action Team, we've got the Food Security Action Team, we've got the Early Childhood Education Expansion Action Team. And they use it to procure funding and to do strategic planning. Did you want to speak about Mary Jo? Or did you expand?
I did, yeah, the after school programs.
So those were the responses that I got back. Unfortunately, I was out sick for quite a bit, so I wasn't able to get to as many people as I hoped for. But I guess I also wanted to bring to your attention like some more specific data to very specific questions for MCMS and MCHS. And I know we kind of went over this a little bit, so I won't go over all of them. But I do have more recent 2019 data. So the same question on both surveys for 2017 and 2019. During the past 30 days, on how many days did you have at least one drink of alcohol? For the middle school in 2017, they said 12.1%. For 2019, they said 8.2%. And I think that's a great change. It's good that we know that that change happened. And for the state, that was 6.6%. For MCHS, that same question during the past 30 days, on how many days did you have at least one drink of alcohol? MCHS was in 2017 was 46.9%. In 2019, it was 36.9%. And for the state in 2019, it was 29.6%. And then I guess as we're thinking about the regional level, that percentage for 2019 was 35.9%. So again, like, do we want to be lumped in with the region when it doesn't accurately represent what our community is experiencing? Let's see. I think a pretty important question during your life: how many times have you used methamphetamines? And for MCHS in 2017, it was 7.4%. In 2019, it was 3.2%. And for the state in 2019, it was 2.1%. So we do have some positive things happening here. For this question, during the past 12 months, have you ever been the victim of teasing or name calling because someone thought you were gay, lesbian, or bisexual? For the middle school in 2017, 19% reported yes. In 2019, 23.8% reported yes, and for the state, 19.2% reported yes. And again, I'm sorry, this is a bunch of numbers. And then for the high school, because they didn't have exactly matching number or matching questions, because we talked about the censored versus non-censored surveys. I think this is what happened there. So the high school, I tried to find a similar question to compare that to. So during the past 12 months, have you ever been a victim of teasing or name calling because you were because of your actual or perceived sexual orientation? And so for the high school, unfortunately, there wasn't 2017 data, but in 2019, 36.9% reported that they had been a victim of teasing. And in 2019 for the state, it was 21.8%. Earlier it was mentioned, and I've definitely heard it in previous board meetings. Well, if somebody reads this, they'll go on to do this. That is not accurate. That is the whole premise of that is a very large myth. And if you've ever heard or if you've taken Question, Persuade, Refer, the whole premise of that training is to ask someone whether or not they're thinking about suicide so that you can connect them with care. And there are studies that show that asking somebody directly those questions does not lead them to doing those behaviors. And so I think most importantly, we need to ask these questions, whether or not they're hard questions to ask, because again, the youth can decide whether or not they're going to answer it. And it may be their only opportunity. It may be the only time they can truthfully use their voice to answer that, because they may not get that opportunity outside of the survey. And I know that sounds silly because it's an anonymous response in a survey that gets aggregated, but it paints a huge picture. It paints a very large picture for this community. So in regards to that, the question that was asked for the middle school, have you ever tried to kill yourself? And to which they answered yes. In 2017, 11.6%. In 2019, 12.3%. And for the state, 8.9%. And so for the high school, slightly different question, still related to suicide. During the past 12 months, how many times did you actually attempt suicide? So for the high school in 2017, for one time where they attempted, it was 3.2%. And for 2 or 3 times, it was 3.3%, again in 2017. 4 or 5 times, it was 0.6% in 2017. And in 6 or more times in 2017, it was 3.5%. And I did some numbers here and I based it off of the total responses. And I think for the 3.5%, it was somewhere around 40 kids that had responded that they had attempted 6 or more times. And I think that's ridiculous. Like, why are these kids doing this? And that's the kind of information that you guys are considering not collecting. We just had our Suicide Prevention Coalition meeting earlier today, which like, in my role, that's what I do. I do the suicide prevention grant coordination. And we talked about data. We talked about the importance of data. And we had a presentation, and the whole premise of the presentation was that which is measured improves. So that's pretty much my thing, unless there's any points that I missed on that document. I will state that another concern that was brought up by the board a couple of meetings ago was, well, why can't other organizations just do their own surveys? It's not that easy. Surveys cost a tremendous amount of money, and the state provides a free service. So when we talk about not duplicating services, that's kind of what we're getting at. Like, why would we want to ask our local partners to collect this information, to put this in their budgets when it's already a free thing from the state, to have a controlled, randomized controlled data collection so that our local community partners can provide programming, so that they can provide services to children outside of the school setting, services that will benefit your teachers and your staff. So I'm sorry, I'm a little worked up about this, but it's really important. So thank you for your time. I know it was a lot of numbers and talking.
Thank you, Arlena.
Thank you, guys.
Yeah, so that's basically we have. Do you guys have any questions that are coming up? Like any clarification, any questions that we can answer? Again, we are not in charge of this survey. We are simply advocating for people who use this data to serve our communities. So we'll do the best we can in answering them. I really wish Healthy Kids Colorado would spend a lot more time educating their staff, the school staff. And but
If we don't
but you have us.
And if we don't have an answer, we're happy to get you an answer.
So this is gonna be in the fall of odd years, is that what it is? Done in the past?
It's every other year, so it'll be 2023. And they generally, my understanding is they reach out to the schools in the spring and let them, or the fall, and let them know it's coming. Which one would you like? Would you like the censored, or, I'm sure they'd probably just give you whichever one they could give you, but that's why we have our voices, and you say, you want the censored version, or we're okay with that. I talked to somebody at SWOS, they're okay with the non-censored version, but that may not be the case for the middle school,
So were the results that you were showing us tonight, was that all from the censored version then?
That one I don't know, because it didn't have any, we didn't cover any of those questions on that. That was simply their presentation to the community after the 2017 information.
I think there's certain questions they ask across the board. So I think those were like the responses for those like uniform questions.
You're not gonna get those ones off. You, like I said, the censored versus the uncensored are the sexual questions. And I think when we looked at them, there were like 6 or 8. And you can pull up the Healthy Kids Colorado survey online, and you can see the 2021 censored and the 2021 uncensored. And it's really just that little gap.
I think, go ahead.
Sorry, because there seems to be some confusion on whether it's electronically or if it's paper.
I think you can choose.
Okay.
The last I heard, you can choose.
Okay.
I'm not really sure. I mean, back when my kids were taking it, it was paper. That was only a couple years ago, but I don't recall it being electronic, but I'm sure. And I read where it is. Any other questions, comments?
Do you know how much total in grants these combined people that use this data, how much they are able to get?
I can speak for us. I mean, for the health department, it's not part of the overall Colorado National Collaborative, which is a suicide prevention grant. We were specifically sought out because it was us and 6 other counties because of our high suicide rate. So they came to us and said, you guys need this, and we need to improve this. And so that's how we got that one. And we definitely use that. That's about $200,000 a year. I can't speak for the other entities. I'm not really sure, but I mean, if they're anything like us, every little bit matters.
You get 200,000 a year
For
From-
one grant, no.
from doing Healthy
No.
Kids?
No.
No, from something else,
We utilize the information to help us obtain that
to
specific
obtain,
grant.
okay.
Not just that information, because the suicide doesn't just pertain to youth. We have a very high suicide rate of middle-aged men in our community.
Okay.
So we utilize a little bit of everything. And I know that the Pinion Project uses it for their youth suicide prevention model. And I'm not really sure how much that is, but I know it's a staff person who does outreach at the schools, who does outreach after school, who sends out education and ways to talk, to get help. And I think they're pretty much one of the only ones that do that, other than the rest of us who do free campaigns that come out. Right now, there's the I Matter campaign, and that provides 3 3 free counseling sessions for youth. It works with the parents and helps to connect them with potentially longer term care, but it gets them connected. And I checked on that. And I think we've had 2 hits of use in Montezuma County since September. So.
You should share it out. We poster it all around the different schools too, so we definitely share it out.
Yeah, so it's not, it's very valuable information. It's really sad if we don't have it. And it makes really knowing what our youth need difficult if we don't have it. But we can always do what La Plata County is doing, or what the state says is the issue.
So you've used it 2 times in 17 and 19?
Oh, we've used it since it's been out, years.
Okay.
Every
Right.
2 years it comes out. Again, there's data sharing agreements. We have to ask for it from MCHS or whoever's taken it. They don't just hand that out.
Okay.
So just out of curiosity, I know up there it said like 408 schools, and it was like 80, like I think this was statewide, like 80,000 students that took the survey. But locally, and it might be in, and I may have missed it in what Mr. Chandler had sent to us, in our district, roughly how many students, since we pick how many classrooms and who takes it, about how many students get surveyed?
It's right here. So in 2017 at CMS, 408 students took it.
At CMS?
At CMS in 2017, 408 students took it. In 2019, 120 students took it. And this is also at CMS.
Okay.
At the high school in 2017, 375 kids took the survey. And in 2019, 464 took the survey. My guess is the reason why there's a gap there in those 2 years is the principal at the high school may have been aware and had distributed it accordingly, and maybe the middle school was a little less paying attention to it. Again, it's Healthy Kids' job to be educating everybody on how to use it and how it's best used. The more numbers, the more students that take it, great. Maybe they only randomly selected 120 students. I'm not really sure, but I do know that those are decent numbers. And then we also have Dolores and Mancus in 2021, because of the loud voices that are upset about this. It's my understanding that Dolores and Mancus did not take it. And also the middle school here did not take it. So now all we have post-pandemic, we're right in the middle of the pandemic, however you look at it, is MCHS totals for our entire community of youth. And
that was just for 2021.
yes. And again, they won't tell me this. I'm hearing this from school board members. I'm hearing this from staff, because Healthy Kids Colorado won't really tell us, because we're small. You could figure it out. Well, now we know MCHS is the only one in the county that took it for 2021.
Which
And-
we're grateful for.
Which we are grateful for.
People are gonna take it.
But now, it's not anonymous. So, any other questions?
No, but we do have your information. We can reach out to you, because we understand it. We have a good year at least or more to really dissect this, discuss it, really dig deeper into it and get, I have a few more questions. I'll probably just reach out
Please
to you guys to get some answers for that.
Yeah, and again, this data that we shared about specifically about MC or the middle school and the high school, I didn't put it up there because of the data sharing agreements. However, you guys are school board members. If you want to come, or you can go to your principals, and you can scroll through that entire thing. And it really is eye-opening. And again, it's not all the negative. We want to be able to celebrate the positives too, and it would be really nice if we could have our own local data. It's really important, and I think we can all agree that we're not always like LaPlata County, and we're not always like the state of Colorado. It'd be nice to have our own. And it's every 2 years for 30 minutes. And choice. I am all about choices. And as a parent, I would want the choice to be able to have my student participate in this. And that's just that's my. Is that it?
Thank you very much.
Thank you.
Thank you guys for
Appreciate it,
having
ladies. Thank you so
Thank
much. Okay. Discussion item B, Cortez Wrestling Club request. Do we have that somewhere that we need to read?
You should have in your packet,
I have the policy.
Oh, this is PDF, then also PDF.
right, it's the policy.
But do we have anything specifically from the middle school or from, I'm sorry, the Cortez Wrestling?
I actually have never had a conversation with this organization. But I understand that there is,
Yeah, I'm looking.
I'm just curious how, independent they didn't contact.
no, they didn't contact me. They didn't contact me. So, but what I did is I've heard from some of my executive directors about the wrestling organization club, going and speaking with them in regards to waiving the facility use for their club. And so what I did is I pulled out the policy because this community use for school facilities identifies that if someone is utilizing our building, we need to provide them a fee, as well as requirements for insurance. And what I have found is, historically speaking, when we talk about facility use agreements, what has happened is certain entities have been allowed to waive the facility use agreements. And generally speaking, we don't waive facility use agreements. I have one exemplar of this year. We waived the facility use agreement with Pinion Project, and that was for our 4-year calendar based off of providing adequate care for kids for families who have to work full-time on Fridays. And so we made that waiver because we changed the school calendar, and there were many families who didn't have adequate childcare.
So the Pinion Project will be using one of our schools.
Yes,
And what about the insurance?
we have insurance.
We're paying the insurance for them.
No, we have their insurance.
They
Yes.
have insurance.
Yes,
And do they have, and this is my concern, do they have the right supervision so that when the schools are open, no one can just wander in and go into a restroom and attack a child or something like that? Do they lock the doors? What is the process of protecting our kids?
that's a great question. I do not know exactly which custodians will be there, because if you look at the agreement, there has to be a school person.
But if we have a custodian there, then who's doing the custodian's job if they're supervising kids?
The custodian is not supervising kids.
So you see where I'm going with
Yes,
this?
I do.
And I kind of feel like if we waive it for one, are we going to waive it? Where do we pick and choose? I read that the volleyball, Cortez Volleyball High School, teenage, I don't know, was using our middle school for practice and stuff. Are we charging them?
Is it high school? Is it our high school? Because if it's our organization, we don't charge.
It's a community volleyball team.
It's a youth volleyball
So
program that
that would be charged.
and
Are we sure?
It's $25 a time. and it is charged.
Again.
I
No, it's
know-
more than that.
Do we
I know-
have supervision for
Well, we have-
our kids?
We changed the schedule.
I have the
Or-
schedule from off the website here.
Right.
And it's,
Well, the gym is different. The gym is different. I was talking about,
yeah, we're talking
For-
about volleyball.
yeah, I wasn't talking about the gym, so I apologize.
Oh, yeah.
You're right. The gym is different. So you can see the prices here. Did you guys get this sheet?
No.
Okay. So here there's a sheet of the facility use fee. And so for a classroom or a conference room, it's $25. For the gym, which is out of district nonprofit, it's $100, and it's based off of different categories. So this was updated when Ms. Eldredge came on board. We changed the facility use, or she did, I wasn't here yet, but they changed the application for facility use because there was we had people who were here utilizing our grounds, which is the huge liability.
Yeah.
And so for us, we were looking at the liability of, we have people who have used our facilities that we don't know if they're going to get injured. I mean, wrestling, any kind of sport has the potential to be injured. And so Ms. Eldredge looked at she worked with our insurance company to identify specific criteria that they recommend in regards to the facility use agreement. And so these are the charges that we have. And if we want, I might have, someone, would you like a copy of this right now?
It's on the website. I can pull it. Did you
Okay,
say you
because I
pulled it off the
apologize.
website?
I thought we'd gotten this to you. Did you want to add anything, Ms. Eldredge, in regards to this?
We are following the guidelines of SIDSTEP and our liability insurance company provides direction on how it should be charged, when, and to who. And then if there is a waiver, where that would fall, and that would be specifically for our students. So the wrestling club that is on the agenda that is requested for their fees to be waived, they went to our maintenance department. Debbie Canada handles the applications. They filled out the application and requested the waiver. She sent it to myself, who signs off on the application and assigns the fee according to the category that they fall under. I did not waive the fee because it's not specific for Montezuma County. It's Four Corners. There's other schools outside of the county. It's not part of the school, but a community activity. And they had used our facilities in the past and the fees were waived. However, according to SIDSTEP's guidelines, we should not waive those fees. And so I placed the amount according to our basis and sent it back to them. They requested again if they could waive the fee through the superintendent, and again, they were told no, so that's why they wanted to bring it to the board to have it waived. They're not in attendance, so I'm not sure if they knew that they needed to do that. I don't know, I haven't spoke to them, but it's very important that we make sure that we follow the recommendations from our liability insurance and follow these guidelines on the facility use, because if we do waive a fee for one group, then the next one that comes, we have to do it for them, and then for the next one, and for the next one. Otherwise, we wouldn't be treating everyone fairly.
That's right.
And there is a reason why we have to charge. We have to pay for someone to be there. We have to pay for someone to open the doors and lock the doors. We have to pay for janitorial services. And this would be every single day after school. And it's a great program. I mean, my own sons were in wrestling, and I'm so glad that they had the opportunity. And I hate the fact that we have to charge a small club like that. but we still have to pay someone to come in and clean up after them. And that's on top of what they're normally doing, because they're already in there cleaning. We have to make sure that there's security, that the doors are locked, and that there's not a bunch of people in school, and there's all kinds of reasons why we have to charge. I mean, and we have to make sure that they have their insurance, that they show proof of insurance. It is a very minimal fee, and I can understand why they would want it waived, but again,
How much is it?
Well, I have to disagree that it's a minimal fee per day, per
That's
time.
per day.
it's for an elementary school cafeteria. It's not for a middle school or high school gym. And the fee that was assigned to this one, I do believe, was $25 per day. So it'd be 125, well, 100 now per week. If you look at their application.
And if we look at the policy, it says, the board further believes that tax-supported school facilities should not be used as free or low-cost facilities for non-school groups to conduct their ongoing business or activities. And so there's a lot of very compelling information in the policy itself.
Yeah, I mean, we all know where I come from on this whole thing, but,
Something to-
yeah. Yeah, I think I'm gonna echo
So I'm
him,
just
is,
gonna preface, I have to recuse myself in a sense because I am on the board of the Cortez Wrestling Club. But I would bring to your attention what they're looking at in the policy and trying to get an answer from.
yeah,
So it also says organizations connected with promoting recognized school functions may use the building without charge. The idea is these are our kids. Dolores has a wrestling club, Mancus has a wrestling club, and these kids are going to be feeded into our program.
Right.
That's
and that's exactly
stance
where
here.
I'm going from.
the other piece is this also says any special requests or exception of policy and regulation must be approved by the board. So they're just reading the policy and trying to figure out. And so I don't know, I spoke with them and they're under the impression they were going to show up when they could talk back and forth on the 18th.
Ah,
And yeah, I mean, it was brought to my attention by the basketball program today. You know, they want to do that, and it's going to be our own kids, our own Montezuma-Cortez School District students. And it's a feeder program for our high school programs, for our middle school programs. And and I'm sitting here thinking about that, listening to these ladies, and we're trying to do positive activity things for our students to keep them off the streets, to keep them active. But we're charging, I mean, what we're looking at with the basketball program is they're looking at 2 nights a week, both gyms, for an extended period of time.
It's actually 4 nights a week because it's
Yeah.
2 nights a week for third and fourth graders. And
Yeah.
2 times a week.
Sorry, yeah. So yeah, we're looking at $600 a week
Yeah, and I met with the
for
rec,
these kids.
the Parks and Rec coordinator, and she was very concerned because it was waived in the past. And we're talking about elementary gyms. Not much, there's one right over there, not very big. And to Stacy's point, this is keeping kids out of trouble. And sports is more than a game. I grew up playing sports. It's more than just a game. It's a camaraderie amongst each other. You learn how to take, the coach telling you what to do when you might not want to do it. Well, hey, that's life. You learn how to do that. And then adversity, how are you going to face adversity when something's not going right? How do you hurdle that? How do you move on in life? There's a lot to sports. It's more than just putting a basketball in a hoop or wrestling a kid on a mat or hitting the ball. But these kids need this. They did not have it last year because of COVID, obviously. My kid is itching to play. He asks me every day, are we going to start basketball? When are we going to start basketball? And I don't have an answer. And it's very sad if it doesn't happen. And these are kids, again, like Stacy said, that are in this county. So how are we going to treat that? Are we going to waive it? Or are we going to have a small fee? That's something that needs to be brought up firsthand. So, like the Parks and Rec coordinator, she knows what kind of registration fee to to ask to cover this, but then she has to meet with the city to raise those fees. She can't just say, well, we're gonna be asked this fee for the facility usage, so we're just gonna make it 30. That's not how it works. She informed me. She has to go in front of the city and have those changes made, which takes a while to do. So,
And I'm not saying that we shouldn't charge, because we
Yeah.
do have to cover some of our costs.
Our
But
custodial.
our custodial costs, our cleaning costs,
Utilities.
some of those,
Like
but
lights.
$600 a week? Or whatever I don't even know what the wrestling, but by day is, or by time that we use it is, that's a lot of money. I mean, basically what we would do if we kept these charges is we would kill our programs.
yeah, because I remember
We would kill
when I was a kid.
all of those programs. And not just,
all these little gyms.
and not just this, but softball in the summertime using Panther Field or using Englehart Field.
And then all the coaches are volunteers.
Yeah,
I get it. I've been volunteering coaching for a long time. I haven't made 1 cent off of it. I don't do it for the money. I do it for the kids.
yeah.
That's what matters to me.
Are these our kids, our personal kids, our Montezuma-Cortez RE-1 kids?
The large majority, it's not, there's gonna be some kids from Dolores and Memphis who would rather come here to wrestle in this club. But it's,
But Dolores and Mancus has their own program, and Mancus has a phenomenal wrestling coach, so I bet we won't get Mancus people.
I just want to point out too, that the regulation of this policy also says any organization, individual, regardless of classification, shall be required to pay the cost of custodial services and facilities. The policy already kind of covers everything on that sense, like even the board would have to change a policy, you can't waive that part of it, right? So just.
And so might I add, if we choose, see, the thing that we have is we have to be consistent.
Yes.
So if we allow a club in or an organization, then we can't discriminate against another one.
You're right.
So the thing that I'm asking for, or that I'm discussing here with you all, is we have been extremely inconsistent in the past, which is an OCR and Office of Civil Rights complaint. And we have to be very careful on behalf of our organization that we are even, Stephen, and we make sure that everything is taken care of. It's similar to what Kyle just brought up, is we are required to have someone on premises, an employee on premises when it's being utilized. So when anything is happening, regardless whether it's a club of sports or arts or band or and not affiliated with our high school or our mid school, we have to have someone there. And so I think, what we charged previously was $30 for the custodian.
A day or a week?
No, I think from the old, let me see what the old one says. It was 30.
It was minimal.
Yeah.
It's and I'm going to say this has been a battle that we've been fighting for years.
Right.
I fought this battle 10, 15 years ago too. Not just with the youth wrestling or the basketball or the volleyball, the community concert people.
Yeah. Do we charge for them to come in and?
We do, but I don't know what we charge them now. It was minimal then. Are we charging them every time they have a concert of
They have not been.
$150?
Several years,
They have not.
because there's been an agreement, Mr. Robinson told me this today. There's been an agreement that they would provide
Free concert?
Free concert to the students or something.
Student, like they
Yeah.
would go into the band room during the day and have a smaller group session with some students.
So,
trade for that.
And they give so
So
many
we're
tickets to
waiving that.
students to come to the concert free at the night
Right, yeah.
So we're waiving
There
that.
was
as part of their.
that they didn't fill out an application and submit it to even
Oh.
be reviewed to be waived or not.
Okay.
But recently there was, the law enforcement provided a community presentation on drug task force at the high school. And that was not waived, and they paid the deposit, they paid the lights, they paid custodial fees, the auditorium fees. I mean, it was a substantial cost and it wasn't waived and they took care of it. There's been several applications that have come through and the fees weren't waived and they paid. It's just, it's not my place to waive anything as far as looking at the applications come through and, you know, if they fall into the category where they're not charged, that's one thing. But if they don't, then there's a fee there. And then if they don't want to pay that fee, then it's not my place to waive it. That's where they would need to come to our Superintendent Vanderway or the board. And so
are they offering, and I'm asking Kyle, the insurance and stuff like that? They'll have all of that?
We have to do all of that still.
And I know that they charge for the kids to
Right.
wrestle.
It's a $65 registration.
If I can say, first of all, Ms. Eldredge, I think that you made the right call. Like Kyle was saying, some of these kids are in this district, some of them are out, some of them are not even in this town. So I think that's the right call. But I coached a baseball team this last fall and we had to have our own insurance to use the field.
Yeah.
So I think it'd have to be something similar to that. To the gym.
And they do have their own insurance.
Right.
And the community volleyball team that I read about I'm sorry, I keep coming back to this, but it's all the same. We've got to be even.
Right.
Across the board. Do they have?
I'm sorry. As a former principal at Lewis, you know, we had basketball teams coming in and playing there all the time. We had at the time an MOU with Parks and Rec to make that happen. So like we would never charge from Lewis, but that's a different agreement than you might see with the wrestling club.
Mm-hmm.
So I think we're looking for some consistency across the board.
The challenge with an MOU is it's a memorandum of understanding and it's not legally binding.
But
That's
if
the challenge.
we waived the fee, and we can't vote tonight, we can't make a decision, but if we'd waived the fee, then I would demand personally that they have their own insurance and they pay the custodian. And possibly the light.
Person who's there for the time that they're there.
But then I would also have to say, you know, you have to have a door locked, strangers walk in. You can't have kids running up and down the hall because mom and dad's watching Johnny practice while Susie and Timmy are playing chase up and down the hall. Believe me, my son wrestled. He did Pee Wee wrestling. I am so for that. But I also know what happened when it was going on. And so mom and dad has to be on there too.
And we're very thankful to Mr. Pearson because that's exactly what happened a few years ago was whoever was running the club that wasn't watching all of those things and they kind of did a little bit of damage to the building. So
you know, I mean.
And I know that basketball is going to have their own liability insurance too.
Well, they all have, it's a $2 million. Yeah.
Katie,
$2 million.
I'm sorry. They're asking to use Timber Gym, and so I actually have the agreement here. They're asking, or what is on this slip says, a damage deposit of $250. For January, the total cost will be $225. For February is $400. March is $475 and April is $400.
And who's that? Who's they?
That's the wrestling.
The Cortez Wrestling Club to use the Kemper Gym on 4 nights a week. From 1/17/2022 to 4/30.
Well, see, then that conflicts with basketball. Kids in our own district. You know,
Well,
I mean, if I
We need to
was,
see the application. We need to process the application for that to determine if there is any cost or what it is. So if
And the policy
if we're
says it
looking
can't
at
come
it,
with
it could be a huge amount.
school.
We
Oh,
need to
that's
see
right.
what the application
Yeah.
is. We need to determine what category, what facility. And then we can process it based by our fee schedule. But just assuming that it could be a huge amount, we haven't even addressed that yet.
And I'm just going by what Jason was told by Deb today. That's what he was told. with the 4 nights a week.
And I just have
both
a
gyms.
quick question, and this is probably, but you've got to roll up mats every night, right? Are you hauling them out of the building or storing them in the building?
So they'll probably be stored, I would imagine, if it was gonna be a Kemper, probably, I don't know. That's exactly, that's, you know, I mean, that's a good question because. if-
And who sanitizes the mats
Well,
before
we
you?
have to-
Yeah,
In wrestling, you kind
have
of
to.
make sure you do it. 'cause we don't
Yeah.
do rings
That was even
anyway.
pre-
I started to say ringworm
They
is
did that at
prevalent
home.
during wrestling.
Yeah, we're gonna do that regardless if you guys want us to.
President Noyes, so I can attest to, again, when I was out at Lewis, how this works, because we had wrestling and basketball. To Mr. Frazier's point, we would schedule it so that they didn't overlap, like wrestling would come in first for an hour or however long it was. They'd roll up their mats, they'd be pushed up against the wall, one of the walls in the building, and then basketball could come in afterwards and have their practice. That really depended on the flexibility of the coaches. Usually everybody worked well together so that they could all utilize the space, but it's
Good.
I want to add to that too, that as an AD for the past 3 years, we've done this a lot. And our rule was always for practices, those kind of things, when it is our students, that was never an issue because it is student serving. And it kills the program if you charge them for those kind of things. I completely agree. It feeds into our program, so it really benefits the district. The challenge and the disparity is when we get into tournaments and those kind of things, because that's where, and that's the conversation that Kyle's discussing, is when we have those wrestling tournaments, and there's 700 people running around the middle school. And we're basically depending on our 3 custodians in the building to kind of regulate. And so that's where we've got to make sure. I think that when there's profit that is coming from the event, that's when we definitely need to have charges. And because the custodial needs there, it's not just supervision. It's 2 hours before setting up and 3 hours afterwards cleaning.
They have to weigh in and everything else, but.
When we're talking about this, the practices is definitely one thing, and I would completely agree. I think that we're killing programs if we charge them for those things, but there needs to be strict regulations of who's using the building and what the supervision, the expectations, because it can be little brothers running around tearing up stuff.
Absolutely.
But also when we get to competitions, I think that we do need to be firm on that because there's a lot of money being exchanged in that, and if the school is just the channel through which all that's happening and we're having to absorb the cost, it becomes a burden. And frankly, our custodians, and we've dealt with this, and I'm very happy about where we're going, but our custodians didn't want to have anything to do with it because it was a disaster.
Yeah.
Like there was
Those kids run up and down, it's crazy.
So we've got to have.
And I agree 100% with that. The practices, we need to work with them, but when they're making money on those tournaments, then they need to share the burden of the cost of it, at least.
Well, I think that somebody needs to work with Cindy to make this correct, because I think we're asking her to do a lot on top of her other job. So.
Another quick question, are they planning on having their own tournament, correct? And so on that day, the charges would be actually more per day, correct?
And
that's added into
That's
the.
not part of this request. This is just to use Kemper.
Oh, so it's a whole different request that they're gonna have that
For the
probably
tournament.
So
not.
if they want to use
Okay.
the middle school for a tournament,
Okay,
that
gotcha.
would have to
Okay,
be
so
pulled out their
So they're right now at
compensation.
$1,750 plus probably their tournament.
Well, in our tournament right now, it's like around $1,250 or $1,300 is what we're looking at.
Okay.
For the one day.
For one day, because it'd be the 2 gyms and then concessions and then custodians and all that other stuff in there. That was the estimated cost when we first did it. But at that time, we didn't know if we could use a middle school, so that's kind of.
And is that bringing in other schools into the tournament?
Oh, yeah.
Yeah. Oh, yeah.
Yeah. How much did you come up with for them? 17?
So including the damage deposit of
Mhm.
$1,750.
Yeah, that's.
So that means that you'd have to have 27 students to break even. How many do you have?
Well, we're still getting some, I think the last I checked, we had 18, but we only opened up registration on the 2nd. So it's only been a couple days.
Okay.
I think that gives us a lot to think about before our next board meeting.
Yeah. But I do agree too, that we need to find, because since I came on this board, even before the board, fair, consistent, please, no gray anymore. I want black and white.
I use our
templates for fire starter. Because it's never, and you have a problem and an issue, and they're, okay, we're gonna take care of it this time, and then it comes right back to us and thought, we took care of this. Well, something got through because the way it was interpreted or the way it was read or what. So we really need to have a solid black and white policy and stick to it and be fair, consistent. And I mean, I would even be willing to go out and raise money for the wrestling club to help pay for this, which I know they're out trying to do some funding, but for any of these activities that have to pay, I mean, I would.
And just so you know, our goal with this is not to eliminate programs and sports and anything. I know that prior to me arriving, Ms. Eldredge was tasked with this. Was it with Miss Canada as well? Who did you work with?
Well, SIDSIP, and then does risk control, and she had taken over the applications in the past under Jamie
Hawkins.
Thank you. And one of the first assignments I had was to review the fee schedule and review with her, the requirement to fill out the application and the process to go through to get it approved or not. And with Jamie's departure, she came to me under the insurance, our SIDSIP insurance, and said, we need somebody who can decide the fees and then approve or deny. And I've had experience with risk management in previous positions, so I agreed to take that on. And her and I worked really well together. But again, she said, in the past, this one was waived. I'm like, well, I'm not in a position to waive anything unless it falls under the schedule that there's not a charge. And so that's why it's presented to you tonight, because it's deviated out of that schedule, and the policy says that even if there is no charge, they still have to pay for the custodial fees.
And it's based off of our insurance provider.
Yeah.
I'm just trying to be very consistent.
Yes, consistent, fair, clear.
All of our goals, like the one goal we have found, the one thing that we have identified is there were a lot of decisions made, whether it's an MOU or a facility use agreement, that were not necessarily fair across the board. And I want to make sure that, with your guidance, whichever way we choose to go and whether we change the funding stream, for me, I just want to be consistent so that we keep our organization, we keep our liabilities down. And when something happens at an event that's not ours, that we're safe.
Right.
And that's what I care about. And I care about kids and I care about programs. I mean, I grew up playing sports. I value it, but we have a little bit of looseness when it comes to even youth programs that use our fields. There's some area that we're not necessarily 100% safe, even if we have the insurance claims from them. Like if we don't have that person, like in our policy, it states that there has to be someone of, one of our people there at any of the events. We need to ensure that it's there and that the person that is requesting the use of that facility, that they're paying for that person. Because it's in the space that we're in right now, it's not all free for us either. When it comes to lighting and just utilization of water, restrooms, and we use like square foot calculations to determine the cost based off of not with this specific fee schedule, but I want you to know that this was a new thing that they were working on, and we're just trying to be consistent. Because we think we owe it to the community.
I know it can be a free for all with the buildings and stuff, but I want to keep in mind too that everything, we're just managing them. They do belong to the community. Maybe something that we could just to think about for the next meeting and stuff too is for a practice type thing, make it a higher deposit, refundable if everything's good, but have a portion of that stays in as part of our cost. But to put the burden back on the group to make sure that there's a $250 deposit. I mean, that's not going to cover one broken window broken or something like that, but make it a higher deposit. And then, if everything's taken care of and stuff, we keep just a certain percentage of it,
We keep 250.
Yeah, or some, a smaller amount. I mean, for practice. Now, a Saturday tournament all day, yeah, that's got to be, you're going to have a lot of staff members there to take care of places. You're going to, a lot of wear and tear on a building in a day's time.
Oh, yeah.
Something like that. So
One additional comment I'd like to make is that this is regulated and mandated through our liability insurance company. And they have a very extensive list on categorizing events, low liability, medium, and high. And they also have a category of events or activities that they say that no, you aren't allowed to do these things at your facilities. And if you do these things and somebody gets hurt or something happens, we will not cover you whatsoever. And, they regulate the guidelines that we have to follow. And it's not just pulling out of thin air, okay, who are we going to charge? And
Right.
I mean, this is all regulated through our liability insurance.
but they're going to have their own insurance too. So
Yeah.
the only thing I don't want to get into.
We still wouldn't be liable in case something happened to someone.
That's very true.
They have their insurance. They have their policy, they have to provide that with the application. But that still doesn't mean that if there was negligence on our
Well,
part,
if somebody slips on ice that we didn't clean up or something like that, yes.
or if, something happens in the facility, we don't have any oversight, or you never know. But that's where it was, the guidelines were drawn from, is our liability insurance, SIDS recommendations.
Makes sense.
Well, okay, so is this something that we'll be deciding on in our next meeting? Like, do we need to, as far as this, does this need to be gone over or do we just need to, do we need to make any changes to this to clean it up? Or is it pretty cut and dry?
It's pretty cut and dry.
Well, and read it, and, you and I are meeting on Thursday. We can discuss what you would like.
Well, no, I'm just because like you were saying, we were covered on like the custodian part, and then we're covered on just making sure that we're not, like I said, we need black and white, no gray. I'm tired of the gray.
We have to make sure that we have all the latest information.
Right.
Approved and on the website.
And with that being said, they are having a fundraiser the end of January at the Elks, and tickets are $20.
And it has not been.
I know they're trying to get basketball going right away.
It has not been revised since 2012. So we do definitely need to look at it.
Yeah.
So then, am I hearing a recommendation to put it on as a first read for next?
Oh, we need to vote.
For the next.
We need to vote at our next meeting.
They're not going to get started.
An action item to vote on what we're going to
Probably not going
do.
to want to start wrestling in July, huh?
Right.
But I don't mean voting, but as we move forward, like for me to work on the next. Because if you would like me to revise this, I can at least work on a draft.
No, I'm just saying if it needs anything, if it doesn't and it's good.
I think that
If we are black and white here, then we're good. But like you said, I'm tired of the gray, and
I think that we should read it and then come back if we have any recommendations at the next meeting, and then the next meeting be a first reading.
And also reach out to me if you have any questions, because we've been reading through this policy quite a bit lately.
Okay.
And, we're also looking for, with the city, we had some kind of relationship, and we're looking for, I think we had an MOU with them, but we can't find it. And
Oh.
so we're looking for it right now.
We have had, or we have had in the past, an MOU with the city where we don't charge for the city rec people to use our facility, and they don't charge us to use McAndrews Field, to use the soccer places, the tennis courts, although we don't have tennis
Right, yeah.
anymore, the golf course. It was just like Jim said, you know, we just didn't, we had that MOU with them that when they did the 3 through 5 basketball programs.
Would it be at the
boys and
high school,
girls.
the MOU? Would it be on file at the high school?
No, it should be here.
It should be here. And so here's another conversation which is not connected to sports. So DSS has used New Wings, that back building. And we have an MOU with them, or a facility use agreement, that all charges have been waived, but they're allowed to be there with keys. So I was looking at their agreement, and the agreement happened in 2020, but it has no end date. So I was talking with Deb Canada yesterday, I believe, in regards to this
They're using
relationship.
what? And they're using what?
The, you know, New Wings, it has that building in
Oh.
the back. So it's like a one classroom / a little office and a restroom, I
You
believe.
cannot go into the main building, just,
No, but it's still our property.
that's kind of.
And they haven't worked on like, they haven't had it cleaned up with custodial services. So it's like, it's not structured. And so this is something that is not, there's no date. So we're going to update it right now. And
I'd rethink the keys.
well, and we need, if we look at our policy, we need to have someone on site.
Yeah.
So, you know, so there's just another, and these keep popping up.
Yeah.
And so I am thankful that people are utilizing their voice, because they've never dealt with this before, because we stand pretty firm on our policies. And that's one of our goals, is to do that.
Do we have any more to say on this action item B?
We'll
Okay,
talk it to them.
okay. Kyle.
All right, board. So I'm gonna do also read a couple paragraphs real quick. Since we have some new board members, and just a refresher for everyone else, kind of gives you an idea of what I'm about to do there. Okay, so the budget adoption process in Colorado works like this. The board adopts a budget for each fiscal year prior to the beginning of the fiscal year. So you have to adopt it in June, right? That's the adopted budget. After the adoption of the budget, the board may review and change the budget with respect to both revenues and expenditures at any time prior to January 31st. After that, only authorized supplemental budgets work. So that's then I would bring a supplemental to you if I need to make a change after this. So what I'm doing tonight is I'm presenting an amended budget. So this is the original budget that was approved in June. And I'm making some changes based on two things: the audit. What the audit provides is true fund balances. So for example, the self-insurance fund, that ended up being a lot worse than we anticipated. So I changed that to reflect that loss for that fund. I've also changed the fact that we get our general fund revenue from half from local taxes, which is property taxes and specific ownership taxes, and the other half comes from the state. And they have a formula that says, okay, we're going to give you this much because we know you're going to get this much in property taxes. So in June, we're anticipating what we're getting. We have to guess based on all these numbers what we think our specific ownership and property taxes are going to be. Well, in December, they certify it, and that's why we certify our bills, and I know what our property tax value are. So now I know what that number is, and then I know what the number of change the state level is. So all of those have changed. So we're getting less property taxes, but we're getting more state revenue, right? So I have to reflect that in the budget so that it's actually what we're going to get. So that being said, I would go through the first 4 or 5 pages because those are the summary pages. And then what I wanted to do is make sure you guys have this tonight. I'm gonna get with Deb and send it to you guys electronically after this meeting tonight. And if you guys have any questions or concerns before we come to the 18th, feel free to address me or figure out, or if you have any questions or anything, we'll get that addressed. And then we just have to approve this at the January meeting. And this will be the final budget for the year. And then we go on and then I get started on.
Is this going to change before our next meeting?
The only thing that's going to change in here, and it's not even something that's up to us. Everything's been updated in here except for our federal and state grants. We don't have the board doesn't have the authority to change that. That's stuff we're allocated from the federal and state. I didn't go up and update those because we're still in the middle of editing and getting a true balance of how much we have left from ESSER 2. So I didn't want to put anything in here. But as I said, I will update that before the 16th, but that's, if I didn't do it then, I would bring it as a supplemental the next month. And it's nothing to do with us making changes.
Or why I was asking is, why does Deb need to email this to us if we've already got a hard copy?
Well, just in case, I didn't know if some of you would just like electronically to be able to view or so just so you have it. All right, so we go over to the second page is blank. The next 3 pages, these are the important pages. These are the pages I need signed at the next board meeting. So their appropriation amounts on the right side. This simply states how much the board will appropriate to each of these funds to make sure we have enough to cover our expenses. Because we don't want to budget an amount and spend more than that amount because we spent more than we budgeted. So those are the amounts we need in all those funds in order to cover our budgeted expenses. The next 2 pages, the resolution to use beginning fund balance. One is a signature page, and the next page is the resolution to ask the board to use the beginning fund balance. So we had Lori Lori Haley, Majors CPA, come in and give our audit, and she notified us that we spent about $612,000 more in our self-insurance. That was as of 6/30/2021. So now we're here, and as of January 3rd, yesterday, we have already overspent $300,000. So we're on track to do the same thing again. So what I'm doing here is anticipating that it's right under $600,000. I'm asking to say, look, we have a fund balance that we carried. Can we use that and put an additional $600,000 into that fund so that we don't overspend it again? So that we have enough money in that fund to get us through the year. Now, we have to have a conversation about what the self-insurance fund looks next year, but we're already in this year stuck, and this is what it's going to be to cover for the year. So that's what this page is. So the first page is just the amounts to cover our regular expenditures. This page is asking for additional funding from our fund balance to pay for self-insurance.
Yeah. 500, almost 500.
All right, and then after that, so another blank page, and then this is the budget. And the first 3 pages are summaries, and then the rest all go into the individual funds. So I'll go through the summaries and explain the differences, and then I'll hit some key differences in the other funds, and then I'll stand for questions on this one. So on the first summary page, you can see revenue from local sources. As I said, our property taxes went down, but if you go down 2 lines in state sources, we're getting that much more in state, so it kind of washes out. If you look at total revenue from the budget that's changing is we're anticipating an additional $30,000, right? $29,185. For expenditures, if you go down to total expenditures and go all the way across, we're actually budgeting $292,000 less than we originally budgeted. So we're actually, in a sense, it's called saving if you wanted to. We're gaining money in our revenue, and we're going to spend less. So comes out to about $300,000 less overall. And then the next page is just revenues broken down even farther. So again, property taxes. One thing you can see down there is that $320,000 for para. So 2 years ago, the state would make us budget a certain liability amount to make sure we could cover para retirements in some sense. In 2021, that went away. And so for this year, there's no need to have that there. So originally we had $320,000 budgeted for that contingency. I've learned that we don't have to, so that goes back to the general fund, and that is a 0 line budget. So that's why it says negative 320 there. Again, one of the things that you will notice, if you go all the way down to the bottom, is our total adjusted revenue. Is 19,806 was the original budget, and now we're saying that our revenues are going to be 18,874, which is about $1 million less. And the reason why is because we're allocating more money to the capital projects fund. That was a discussion we had a couple months ago about that plan of getting the roofs done, getting the roof done at Mesa, and those floorings, which we're going to talk about, is an additional about $900,000 than we originally planned. So that right there is the difference that's reflected here. So now that money's there, and I will just come to you for the capital reserve request to take it out from now on. And then I'm not asking you for additional money plus the request. The next page is schools and departments broken down by expenditure amounts. Again, these didn't change much, which was a little surprising to me because this includes the retention pay that we paid. So even paying the additional retention pay on top of what was budgeted, I look at today what is encumbered for the rest of the year, and we're pretty fine, we're close. We're not carrying any money, but we have enough budgeted to cover all that retention plus pay everybody out the rest of the year. So that's a pretty good thing, but also keep in mind that we have pretty good indication that we may be able to get that retention pay paid back with ESSER-3. It's not for sure, but we have some pretty good eyes and ears up at the state level. So again, that might even come back. And then again, at the bottom, you see that 320, that we're not gonna have to budget there. The rest of this is the details of all those numbers in those first 3 pages. But the last thing I wanted to show you is the very last page. This is the self-insurance fund. All right. So as you can see, this was the audit. This was the audit, if you want to call it a finding that she was talking about. Our proposed budget at the top, I have 1.2 million as our fund balance. That was incorrect. It's actually 612. So that's where we lost that $600,000, right? That's the difference. So with that being said, there's your $600,000 difference. Hence why we're going to have to use some of the fund balance, which is almost all of that 612 that's there. I'm asking for permission to spend it because we're going to need to get to the end of the year. When we get to the end of this year, we're going to have 0 left in reserve for our self-insurance fund, and we're going to need to have a good plan for what we're going to do continuing going forward, or else we're going to have to budget a lot more money than we've usually budgeted for self-insurance, which is going to, in my opinion, is going to be tough. So really that's it. And again, this is really just an amendment to the first budget that was approved, because you don't have to go back out to the public. I don't have to get more input. I think this is just a change that I can do before January 31st to make sure that we're appropriately budgeted for this year. So.
Well, thank you for
Any
that.
questions?
Do you have ideas on the self-insurance fund, the things that we can start looking at
I think,
next year?
I mean, one thing that Ms. Eldredge is doing is reaching out to our current self-insurance plan holder, a couple other options on the side to see, 1, what's the comparability, and 2, if our current insurance is actually giving us a good deal, because I don't think we've shopped around in that sense. Another option is looking at the employee versus employer rates. The last few years, the district's taken on the difference, the increases in the insurance. What does that look like to maybe change that around a little bit, or going to the private sector and just saying, give us insurance, these are the things we want, and then they give us a bill, and then I know how much it's going to be, I budget that amount, and we don't have to worry about it. So that's saying it very easily. There's lots of details and input from different entities that are going to be made to have to get to that conclusion.
And I hope to be able to provide you additional information during the board retreat.
Awesome.
A big section that I'm going to work on and to be able to present to you but I've been working with our broker and then another company to give two comparisons and reviewing everything that we have, and so we can bring those recommendations.
Okay, well, thank you.
Thank you.
Awesome. Thanks, Cal. Thank you.
Anything else on that? Are we, no more questions for Carl or Cynthia on that?
No, he's pretty well shot my blood.
Okay, bank information and signatures.
All right, this is pretty quick. I just wanted to get in front of you that I will have to be talking to you three specifically to get the new signatures for our checks. And one of the banks actually requires us to go to the bank and do it. I can't get the paper. So I just wanted you to be aware that that's going to be happening in the next couple of weeks. I don't have anything here officially. I just wanted to get it on the radar that I'm contacted.
Okay.
And that will be secretary, president, and treasurer, correct?
Secretary, I'll find out. I thought it was vice president, and secretary, but I'll make sure.
Okay.
And find out. And if it is, I'll let you know.
Okay.
Yeah, so that's all there.
Okay, and item 3, flooring and roofing project update.
All right, so I just wanted to give you an update. We had an RFP for the flooring and the roof projects, and now we're set. We have the contract signed by the vendors. I will be providing them to Risha to sign. Mesa will start this summer. And there's a couple different reasons why all these projects are going to have to happen in the summer. Mesa and Manaw. Mesa's for sure is tested positive for asbestos, so we're gonna have to get it abated. We have one quote right now. We're waiting on another quote to see what that looks like. And I'm waiting to see if the places we're replacing at Manaw are gonna need to be abated too. I don't know that yet. So in order to do that, kids can't be in the building.
Right.
So that's part of that. And with the Mesa roof, same thing, because they're taking it all the way down, the noise level and the traffic and everything else, plus not getting the materials till probably June, that's not going to take place till the summer either.
And we're doing roof and flooring in Mesa.
Yes, it's going to be flooring at Mesa, Manaw, and CMS, and then the roof at Mesa.
And are we doing flooring in the summer at CMS?
That is correct. It's one company going to do all 3 of those jobs, so they're just going to plan to do it all.
So and is everything all set, ready to go as soon as we're let those kids out? They've got a start date?
Well, yeah, we do. We have originally, and I'm glad you asked that, originally in our contract, we put June 8th. And then they came back and said, is there any way we can get in there the day or two after school's out? Because those 3 or 4 days are going to be important if we want to get done before school comes back.
Do we have a contingency that if they are not finished, they have to pay out something?
Well,
I mean, because that makes them work a little harder.
Well, yeah, and our contract states that it has to be done before school starts.
Or else?
Yeah, there's contingencies in there. So
We kind of made that mistake one time before. That's why.
And that's really why we're trying to get it all hashed out right now. So
Yes.
there's no hiccups.
Thank
It's
you.
already set and it's in months in advance.
Okay,
Thank you.
perfect.
All right, that's all I got on that.
All righty. Thank you for all those.
Bathroom break?
Now, Mr. Wells. Please. Okay. 5-minute break. 5 minutes.
Thank you.
5-minute break.
Meeting back in session here. If we can have Cynthia with her, Miss Eldredge.
We just got called here, principal's office.
I think I said originally when I was introduced to Cynthia, and I didn't answer, that that's what my mother or the IRS called me, so. Not very often do I acknowledge that.
Okay.
On the agenda, it states that I'm requesting to hire an HR generalist to assist in the HR office. You know, I'm not sure if you're all aware, over the last 7 weeks, my assistant has been out of the office. She was able to come back today. I'm very excited about that. With the amount of just getting everything in line, regulated policy for the HR department, compliance issues and reports, and processes and procedures. There's a huge amount of work that needs to be done, and I found it very difficult to keep up on the workload, and so I've requested for some assistance. However, bringing it to your attention tonight, I do not have a financial aspect for it. Kyle and I haven't been able to discuss that, and so this is basically letting you all know that that's what I'm requesting. And so on the 18th, I'll be more prepared with an actual financial amount, the funding where it will come from, and I can do a job description as well, and a justification for the position. This is putting it on your radar that I am asking for help. You know, if we're not able to do that, there are other areas that I could possibly pull in. I'm gonna be honest and transparent and let you know where other areas that I can, so you have both sides. For one, do you remember when I told you about the new pipeline agreement we had with the Department of Workforce Services on hiring the COVID relief janitors? Well, that's been extended through the end of the school year, where it was only going to be the end of this month. And we're filling several positions at every single school, including the admin office. And under the agreement, it was they would do additional COVID cleaning, and then any time that they had extra, they could assist either like as a para or in the office or wherever their background is. And we actually hired the lady here for the admin building. She has a good background in accounting and in office work. And so I have spoken with her, and she's agreed that, you know, she's getting her workload in, and then she can come in and she can help like extra filing and doing certain things. So that would be an area that I could tap into if this wasn't approved. The other one would be, we have a assistant superintendent as admin assistant 50% of the time, and the other 50% of the time she is a grant secretary. And at the current time, I could ask her to do that 50% of her time helping with HR, but that isn't long-term, and I don't know how long I could sustain that. So in the meantime, that's what I'm trying to do. And I would still think that it would be very advantageous for the district to have an HR generalist in the department who is more educated and experienced and trained in like workers' comp and FMLA and ADA and the compliance areas. Some of the, like the ACA reporting I'm working on this month, and the HR pipeline report. So it's a lot of the tedious data information that I could have assistance with while I'm doing more of the directing of the HR part and the recruiting and the insurance and that area. Any questions?
And might I add as well, we have had a tremendous additional utilization of HR needs just based off of the COVID and COVID leaves and quarantines. And, we have had such a tremendous increase, like that alone has had Ms. Eldredge having to attend to other areas that are more than she would normally have to. So it's additional on top of. And so I think, we have talked, the three of us have all talked together in regards to how we can support this position, because I think it's extremely important, especially right now when we're dealing with uncertainty. And come, January 16th, the funding for COVID relief kind of disappears. And so, we're looking at all of these things, and I think, we talk quite often, and I see her tremendous workload. And I think if we could support her, what we have found is our policies and procedures that we have utilized within human resources is very similar to our policies and procedures for facility use planning, that we have treated many of our employees with benefits and not really addressed their real HR concern. And so we're also at the same time trying to change the culture of HR within our organization so that we are providing everyone the same services, the same benefits, the same answers. As some of we just went through a situation where, we had an employee who was asking for, different types of disabilities, short-term disability, long-term disability, FMLA, and they were requesting things that we really can't provide, but it's happened in the past. And so we're just trying to clean everything up. And I don't mean clean everything up. We just want to make sure that you all can stand behind a policy and know that we're following that and that we're directing our staff to follow that as well. And so I think the supports would be very useful.
Do you need some?
Also, I wanted to clarify what she meant as far as the COVID relief will be expiring. That's the 10 days of paid COVID time off. So if an individual was quarantined or they were positive for COVID and they needed time off, we gave them 10 days of COVID leave on top of their sick leave, and it was required by the federal government to do so. And that expires January 16th with the option of extending it to February 22nd. So we'll find out probably January 15th if they're going to extend it. But in the meantime, that's been a huge undertaking to track who qualifies, who's used it, how much time. I mean, without Stephanie Martinez and payroll taking a lot of that, there would be no way to keep up with it all. But that's more of a clarification on what that COVID relief she mentioned was.
So if you got help, would it need to be somebody that knows how to keep information confidential?
Oh, most definitely.
So you
And
can't
have
just hire somebody off the street.
like the COVID relief person that I'm gonna have help. I have a confidentiality agreement that anybody that works in my office would be required to sign, and that is held out under court. And so if any of the personnel or confidential information were to be disclosed outside the office, that person would be in
Deep trouble.
and financially responsible as well. So I would most definitely cover the district's case on that one. And that's why I have not brought just anybody in to help. I could have had a substitute there are several subs that do like secretarial
Right.
subs. I could have brought subs in, I could have had other different people come in and help, but as Kyle knows, I have just been very uncomfortable allowing just anybody in the office on that. So
Thank you. Kim.
it's hard, you know, it's hard to manage that.
And in a small community, our primary concern is, you know, people see someone's name that they know, and then their curiosity is piqued. And, you know, I understand that, but our primary concern is people's privacy rights.
Yeah.
Right.
And so we want to ensure, to the best ability that we can, that we're caring for the people that work within our organization.
I've even gone to the extremes of having the other person in the other department that's come in and helped a little bit, sign that confidentiality agreement. I mean, anybody that has access to a personnel record of any sort or file or paperwork has to sign it.
Thank you. Thank you.
Back to your 10 days too, a quick question for you. Over and above the 10 days, then what you just said is that comes off of the sick days for the employee,
So
correct?
how it works is, so we're required to provide 10 days of COVID leave above and beyond any personal leave, sick leave, discretionary leave, or vacation leave for individuals to take if they have been affected with a quarantine, or if they have an immediate family member who would be a spouse, child, or parent, need their assistance taking care of them with COVID, or if they themselves are affected with COVID. And so initially, when we had all of the quarantining for staff members and notification, the staff member was sent a quarantine letter to be quarantined for 10 days. Then that staff member would notify me and provide a copy of the quarantine letter, and then that would go towards their COVID pay. Or let's say a staff member tested positive for COVID and they received a letter from the health department saying you need to isolate for 13 days. They would notify me, and then that 10 days of that would go towards their COVID. I mean, they would get paid under the COVID leave. If they take more than 10, then they would have to use their own personal sick leave. And if they utilize their sick leave, then they would have to go into their discretionary. And then if it's a 12-month employee, they have to go into their vacation. And we've had several who've used the COVID and all of their sick and all their vacation and ended up, using all of their leave because they were so ill from it. But this was mandated through Colorado mandate and then federal mandate. It started, back in 2020, and then it was extended through January 21. It was extended through January 16th of 22. And I've been watching it very closely because there's usually a lot more discussion and communication about whether or not it's going to be extended. And there hasn't been any discussion on, it's going to expire January 16th with the option of extending it through the 22nd through the state area. So any time in the past that's been extended, it happens the day before the date of the expiration. So I'm expecting to hear something on one of those 2 days, and if not, then we're done with it. I was asked to send a notification out to all staff, letting them know of this expiration date, when this benefit would be meeting. But I feel that it would be better for the district when we notified them that they had this. At that point, it stated that it would last through January 16th of 2022. So instead of sending it out this week, saying in 2 weeks, the 10-day COVID leave is going to be expiring, I think it would be best to wait till we're closer and then reminding them of the expiration.
Okay, thanks.
Have we had, and is it a possibility that a teacher's been put on quarantine and then come back and then turn right around and back on quarantine? Do they get the pay both times?
They only get 10 days total.
10 days total, okay.
So if you were out 5 days the first time, then you have 5 days left.
Okay.
And that's all being tracked.
Okay.
Payroll system.
Wow, a lot of work.
Yeah.
Well, we need to give credit to Stephanie Martinez. She, seriously, because she knows our payroll system like the back of her hand. She can answer any question. She is such an asset to this district. I just would like to formally, publicly praise her. I wish she was here, but I praise her every day because she's so awesome.
Perfect.
Any other questions? Okay, thank you.
Oh, thank you.
Thank you.
Thanks, Cindy.
Okay. Student discipline. Discussion item E.
Oh, why it's on there, but I keep hearing that our hands are tied because our kids are under Title IX and different things, and we can't do anything. And so I am saying, we need to call CDE and find out what we can do.
When I was,
Just because we've got kids hitting kids, other kids, they're being destructive, and we don't have to put up with that. We need to figure out what the law is and take care of it. Okay, I'm off my soapbox.
oh, I hear you. You know, I was in a meeting today with our attorney, and this is a special ed attorney. And I was meeting with her and Ms. Fogel from BOCES, because we do have a couple of kids who are, right now I'm looking up these kids, let me see. We have several kids who are suspended until March. We have kids who are, I'm looking at our suspension. I have 1, 2, 3, 4, 5 kids currently that have been expelled. And then I have 1, 2, 3, 4, 5 kids who, not including, we had another hearing today. So we have 1, 2, 3, 4, 5 kids who have been suspended so far. And some of these kids have special education.
And we have to meet their needs.
Right.
But we do not have to allow them to rule the school.
True, but it's a very fine line. So when I was meeting with, you know, our conversation today was, we have 2 kids, for example, who have been suspended for quite some time. And the BOCES director was asking us if we could reinstate them into school right now. And you know, our one thing we have seen is an increase of kids that have socio-emotional needs, but also they have violent, disruptive behavior, and they deregulate quickly. Maybe not all that often, but when they do, they attack someone with the scissors. You know, we had a kid the other day that, you know, we just have kids who do things that they're assaulting teachers.
And so you're suspending them?
Yes.
Okay.
But I can honestly say that I have to work in cohort with our attorney on each one of these kids. And because the law states that if a child is doing, demonstrating a behavior that is based off of their disability, we cannot suspend them without a manifestation hearing.
Well, you should have that anyway.
Right. But it's just very complicated. And so one thing we've been talking about is, and the challenge here is a workforce challenge, is, you know, kind of like how New Wings was, but a whole different concept. We are not adequately providing services to our kids. Many of these kids that are in mid-school and high school, we've had since they were youngerlings, since they were 5 and 6, and they were, most of them, not all, but most of them have had a series of traumatic incidents happen in their lives. And we've been putting Band-Aids on them for many, many years. And we really need to provide a better umbrella or system of supports where, in a sense, I'm not necessarily saying alternative placement, because the New Wings model is not a model that I generally would recommend. But we need to find something where we have adequate personnel that are adequately trained that can really help these kids, because we have a pipeline of kids right now that are at Kemper and that are at the high school. And we do not believe, I've had different conversations with both, that our staff has the adequate training or supports. And so the question is we need, and this is not only Montezuma-Cortez School District RE-1. It's similar to the health survey and what they were talking about, preventative supports. We need to provide preventative support systems for this valley, because right now, one of these kids that I was talking about, we've offered alternative placement, which is extremely expensive. We've offered alternative placement for them to go to a residential home to get the help that they need. But the parents are like, I don't want my kid going to Colorado Springs. And it makes sense, it's their child. And even though the child is a handful for them too, and they're overwhelmed, because generally there's more than one child that has these concerns in their home. But if we could look at finding a way to build an adequate pipeline that really supports socio-emotional and deregulation things where kids learn how to not have outbursts, it would really be a better fix than what we're trying to do now. Because what we have been doing has really been having a hard time being effective. And do you mind if the principals add, if they have anything to add?
No, not at all.
Do you have anything to add? I don't mean to put you on the spot.
No, that's fine. I've advocated for this, and those of you who've been on the board have seen my board reports every month. And I'll give you a little bit of statistics. I have had this year on 3 separate occasions students taken away from school in handcuffs. I've had 7 different instances this year where we've had students who have assaulted staff. We are facing up to felony charges in some cases because of these things. And in some cases, they are students identified with a disability. And so it's an incredibly, I probably spend 40 to 50% of my time dealing with these 6 or 7 students on a regular basis. Just trying to, I have ordered IDEA law books because I feel like I need to get a doctorate in this just to understand all the things that we have to deal with on a daily basis. And I am completely supportive of providing an education for these kids, but I would completely agree the level of trauma that these students have faced and the level of needs that they require is something that is beyond our capacity in the schools at this point. And so it becomes very cumbersome for our staff, very demoralizing, frankly, for our staff, because in a lot of cases, it's just on a daily basis, flipping you off, cussing you out, calling them names that I would dare to utter on a daily basis. And this is the norm of what they are. And it permeates out into the whole school. And so I would completely agree with the fact that I think that we need to be able to provide services for them. And I would love to be able to see us provide appropriate services. And that is a challenge of personnel and finances and all those things. But I would highly advocate for the fact that we looking at some type of an alternative placement where these behaviors that are the norm for these students and are a manifestation of their disability occur in a way where it is not so substantially disruptive to our school environment. I've had to put our school in lockdown and lockout, or we call them hold and secure on probably half a dozen to 10 times this year because we've had those things. And so that means kids are not being able to transition from class to class. They're being held in place. I'm having to send emails to parents and say, hey, here's what's going on. And kids are not feeling safe, teachers are not feeling safe. And so I completely understand where that and commiserate with the kids and the trauma that they felt and the needs that they have. But as a principal, I also have to think of, I've got 530 other kids in the school that are missing out on a great deal of education because we're spending so much of our time and resources on these kids. So I'd love to look at opportunities where we can find a way to service and give the appropriate and legal needs for these students, but do so in a way that is not so detrimental to the other school environment as a whole. And what we're also seeing is that behavior that is becoming, frankly, more norm within the school because those numbers are increasing. Is
Because they're getting away with it.
And we're starting to see kids that say, oh, these kids are saying F you all the time. Why can't we say that? And maybe we can do the same things. And it is permeating our school. And frankly, I'll say for the middle school, in a very negative way. We've lost staff this year for exactly these reasons. And, within the past month, we've lost staff because they're done. And when we're having a staffing thing, and when we're trying to make gains and become the schools that we want to, Ms. Vander Way can speak to the fact that our very first conversation, she felt like I was interviewing her, and I just wanted to say,
He was.
I wanted to meet her, and my very first thing is like, if you want to know our number one problem in the middle school, here's the number one thing that we need to address, and this is what it is. And so I just want to share that with you. That's my 2 cents.
And might I add?
Could I share something with you?
Please.
When I was at CASB at the convention in December, I don't know if you know the gentleman, but his name is John Penn. He works for CDE. He's a friend. He has since retired, but he gave me the name of somebody to call. And he told me that this gentleman could put us in connection and help us with our issues. So if you want the name, I will give it to you. But I'm just telling you that CDE is going to have to be our answer. I'm sorry, but I mean, I get so angry at them. But if they can help us, and they're a whole lot cheaper than a lawyer, but his name is.
I want his name.
His name is Paul Foster. And I do not have his telephone number, but if you call CDE and tell him who you want, then when he comes on and tell him that John Penn gave you his name and this is your issues, and how can he help you? Can he tell you who to go to? Can he give you the legalities that you need? Because this has been weighing on me for a long time. And so I spent my time at CASB at the conference talking to people, trying to figure out what to do. Because we cannot have 4 or 5 kids destroy a whole school. We cannot have that. And yes, I understand that they have special needs. And, shame on whatever's happened in their life to make them that way, whether it's a birth defect or a trauma, whatever it is. We still have to deal with it. And we have to deal with it professionally, and we have to nip it in the bud before it kills our school and our climate. Okay, I'm sorry. I'm one of those.
I did my soapbox.
Well, I'm just very upset about it.
I think the one misconception that we have in the community is that there's nothing being done.
Oh, yeah.
They don't understand how tied Drew's hands are, Katie's hands are, Mr. Lehman's hands are as to what has to happen or what can happen.
I'm glad
Mr. Chandler, sorry.
Mr. Chandler, I'm glad your hands
are tied all the time, but I think that they just don't understand that there really are things going on.
There's legalities that we have to go through,
that are happening, and until you've actually worked in the schools, like 4 of us have, you don't understand those steps that have to happen before something changes. And I spent my entire career at the high school until I started subbing, and I went to the middle school, and I loved it at the middle school.
Awesome.
But I saw the challenges that those middle school people had, and it's getting harder and harder all the time for that age group of kids to.
So we're seeing those same challenges coming into the elementary school, where kids 5 years old coming into kindergarten with more emotional dysregulation where they cannot control their emotions.
Well, is it because parents are not? I mean, I don't know. I mean, that's our big, and we can't blame parents because they're doing the very best they can.
So with the implementation of this program that Drew and I are working with, it's called the Effective Needs Program. Kemper right now, we have 7 kids enrolled in this program from all elementary schools within the district to better support them. And these are all students who are identified with a social emotional disability, who are unable to regulate their emotions, and they're the loud behaviors, the big behaviors, the scary behaviors, the destructive behaviors. But with a school, with my elementary school having 360 kids, we're talking about 4 kids who
Eat up your time.
Who are unsafe, who cause unsafe situations for our staff and other students in the building. But these are students who we are seeking, we have to serve them too.
Yeah,
they need
we do.
resources, counseling, they need mental health services that the district, our community are lacking. They don't have access to the resources that they need. And that is the conversation that we're having. So, but it is sometimes very detrimental to the learning environment for the 360 other kids in my building.
You girls have anything to say?
Sure.
It's your schools. Do you have anything to add to this? Not really?
Well, no, I don't consider us very bad kids, but I've been in experiences like in the middle school plenty of time where fights were broken out. Teachers had to throw themselves in the middle of it. Same thing at the high school. So as an school, it's like hard when like you see a fight and like you try to go like learn about calculus, something that can be difficult.
It makes it hard.
And might I add, one thing to recognize is, for example, we have a student who was suspended, and this student chose digital learning last year, and this student was gone from school all of last year. And so they made a transition from one school to another school this year. And they have never been in that school, but now they're, like, let's say, and I'm stating a different grade level because I want to protect this child, but let's say it's a sophomore in high school. This kid would have missed their freshman year. And so you have a kid who has behavior issues, and then you keep them out of school for a year. And then they come back as a sophomore and they're expected to perform at a higher level when they've dropped possibly academically down. And they do demonstrate violent behaviors, not all the time, but when they do, they go from here to here. And it is very scary, but it's also, we need to be solution oriented and we need to be preventative, because these are also our kids who are going to go into our community as they grow up. And, we have to help them put their best foot forward. So if we could develop a program that was similar to project-based, experiential, education-based program in the mornings with experiential education and wraparound services. And then for the older kids, if in the afternoon they could go out and work, do internships with community members in areas in which they are passionate about, so that they learn different skills along the way and establish different positive adult relationships. We're looking at a lot of different models, but we need to do something, because doing nothing,
we're struggling,
is not okay. And not only on behalf of the kids that we serve, the families that we serve, but also the teachers that we're trying to protect. And these kids and the teachers deserve, like adequately trained staff to help them. We would have to, the whole thing is we would have to adequately pay somebody, because right now we can have this great conversation. And actually, Drew and I were talking about this yesterday, I think. And, even if we had the position open, would anyone apply? Because, most people aren't coming right here because what we offer to pay them, they're like, well, I'll go to Durango and get do the same job and get paid more. And so, so that's what we're working on, because I really feel like we've been putting Band-Aids on. And I've seen kids like tear up classrooms, and you leave the kid in there with adequate supervision, and then you evacuate the whole classroom. And the whole classroom goes out to the playground. Well, we're trying to deal with a child, and it is extremely disruptive. And I think if we looked at really the hours that you have kids either in a situation where they're not learning because of one child,
Right.
it's alarming. It's alarming.
I have a question. All I'm hearing is that the teachers are carrying this burden by themselves.
And the principals.
And the principals, yes. Definitely, yes. But don't you have school psychologists that are helping you out at the same time in these programs? And I have not seen any of them here to be at any of the meetings that I know of, And I think these kids need to be taken care of, definitely. I mean, I'm a bachelor's prepared nurse, and we go through this in nursing as well. But you don't take away from the other kids that are trying to learn and to make it also, which is what we're doing to a certain extent, because your time is all spent. And I think you need these other people, and they're helping you as well, so that you're not burdened with all of this all on your own.
And we work very closely with BOCES. They provide our school psychologist, our social worker, things like that. That we have a team. Most of these kids have an IEP team to rally around and help support make decisions. And so we do have access to that,
But how much time do you have with it?
They're between all the schools.
Yeah.
There's no room for staffing for the same reasons.
Exactly. So that's an issue and a problem as well.
And it's a problem for the whole valley. So even.
Well, it's not just the valley, it's the country.
Yeah, right, exactly.
I agree.
The changes we've seen in the last 2 years, when COVID has hit, has brought about the inequalities of families and communities across the country. And you talk to any educator in the state, and you're finding the same thing. We're not special in this way, unfortunately. And it's, I was talking to a family member who teaches at a $10,000 a year private school. They're having the same issues, when their kids are paying to go to the school. So it's not different. But it's the social emotional aspects that are coming out. It's the trauma that students have been going through. And it's a different environment. For 28 years I've been in education, I've asked the rhetorical question, do you want to graduate high school? For the first time ever, I've gotten an answer of, I don't care.
Right.
The mentality of kids over the last 2 years has changed from K through 12. It's not just, because we do have kids that haven't been in school or learned anything in a year and a half, and now they're expected to step up 2 grade levels. And so it is an unprecedented time that we're having to deal with, and it's not just about the academics anymore. I think that's something that keep in mind, is all the other aspects that we need to work around. And it's affecting other people across the board.
It is.
Absolutely.
Well, I'm anxious to hear about your Effective Kids program. So if you can bring that to us when you get it finalized, I would appreciate it.
it's up and going. So
It's up and going, so maybe you can present it for us.
Okay. Any more discussion on that? Okay, moving to item F, the 2022-23 school calendar.
Well, it's not complete yet.
Okay.
I can honestly say that me and Mr. Parr have been talking about it. We actually, as you know, because of our special meeting last week, we were focused on recalculating numbers for this one. So we are working on the 2022-2023 school year with a a couple of thoughts, I've been looking at the other 4-day school week schools that surround us. And they're a little different than us. They're not focused schools, so we're under improvement. And so we have to follow different criteria. And looking, for example, at Mancus, and I'm not saying we're like Mancus, so please recognize that, but they offer their students 144 school days a year. And for us, we've always done 160 school days because that's the minimum requirements. If we choose to do 144 days through the state, then we have to apply for a waiver through the Colorado Department of Education to waive those additional days. My feeling is I want my kids here for 160 days. But if you look at the calendar for 160 days at a 4-day work week, then it extends the school year. So whether it starts earlier or ends later or both, many people don't want to do that. In looking at Mancus's calendar as well, they also have like MLK Day off, Labor Day off. They have certain days off, which, they have an additional 4 days off, not including their Fridays. And so I don't know how we could make that work. If we added that to our calendar, it would be 140, if we were mimicking them, and I'm just using them as an exemplar. And the other thing that they do is they have 2 professional development days a month. And I'm having conversations of whether we need 2 professional development days a month or whether we would want 1 professional development day a month. So it's just, we're looking through these things to identify. One thing I was considering, so what we're going to do is we're going to start with the 160 day and see what that looks like. And I'll bring to you, hopefully by February for our work session, we'll have something for you all. And we will have several different scenarios for you to look at.
And that will include 4 and 5 day calendar?
Yes. And because, this year is unprecedented. I know I've mentioned this to you before, but generally speaking, you would never change the calendar mid-year. I mean, it's just unheard of. And so now as we go into next year, I think we need to be very cognizant of what we can offer and what you all choose to do.
I would like to make a request that our spring break matches Mancus and Dolores. And our graduation day does not interfere with either one of them or Duff Creek. Believe me, that causes more heartache for us than any other thing.
It's great.
And we have families that some kids go to Mancus and some come here, some go to Dolores, some come here. They're mixed. And we need to make sure that we're offering the right things. So I'm just saying, vacation times, spring break time, all of that needs to be right there. And believe me, and I'm sure that Stacy, you've been there when our graduations have. Yes. And that's not a pretty sight.
Well, and I have a sample, and thank you for that, because I wasn't thinking of the graduation, but I have a sample calendar that Eric sent me I don't know, did you send that to me a couple weeks ago-ish? Anyway, he sent me a calendar for next year. And the one thing that I was going to change was our spring break, because in his exemplar calendar, it has the same start date and end date of Mancus and Dolores because they have the exact same calendar.
Mm-hmm.
And they have their spring break is a week before ours. And so I was just gonna make the executive decision to just move it 1 week forward.
They need to be the same.
And line it up. Mm-hmm. But then when I start looking at hours and school improvement, and I believe kids need to be in school, and that's just really what I believe in, but I'm gonna give you all the options that I.
Another thing you need to look at is PCC.
Right, and no, actually, I mean, I don't mean no. I mean, what I mean by
Telling me no?
is, so last week we had so I meet with them every month. I meet with Dolores, Mancos, and Pueblo, and we're trying to line up our programs for high school and for concurrent enrollment and for alternative certificates in the trades. And we're gonna do it, all three of us together, so that we can provide more robust courses. Right now, we're starting with Pueblo. And it's really exciting. For example, just thinking of, you know, how we can send our kids to Pueblo. And if we have only 3 kids that are interested in a program, but we have 2 kids from Mancos and 4 from Dolores, then we can pull it all together. And they will let those classes fly. And so it's a great collaboration, and we kind of want to start arming this valley with, you know, kids who are graduating with all the skills they need to just go out into the workforce. Because not every kid wants to go, as Mr. Chandler said, not every kid wants to go to college.
No, and we should never force them to. Also, I'd like for you guys to look at one route transportation.
And we had a conversation yesterday, or was yesterday Monday? Yeah, yesterday, with transportation, and we brought that up as well.
Okay.
And what we're doing is we're identifying our fleet and how many buses we would need in order. We have 3 buses on the way. One is actually, I think, on the way on Friday, and the other 2 might be on the way, I think. Was it Saturday that we identified?
1 tomorrow and 2 on Friday. They should all 3 be here
Next week.
And so
2 route buses and 1's
activity
special needs bus.
So then we're going to identify how many additional buses we might need to do this, but we are starting the conversation.
Yeah.
And this is a really tough conversation. I know you know it, and I know you recognize it, but shifting the way a department has worked for 40 years, or, well, I know they haven't had a single route. I'm sure you've had it before then, but shifting it back is very difficult. But one of the things to say is, it's not like when I got on the bus in 1978, you know, and I was in 3rd grade or whatever, and I could just go pick my seat. You know, these days what you do is you have kindergarten up front, you know, and then you just go down the line with that as the kids grow older. So you don't have, generally speaking, a 12th grader sitting with a kindergartner. And that, for that reason, it's because of, you know, it's to ease the mind of parents who have kids and who have experienced that their child is getting bullied on the bus. It helps with that kind of discipline, not giving the kids the freedom to sit wherever they want and mix with the differing grades.
Well, I know I've had a lot of community members complain because our buses are traveling
empty,
a quarter of the way empty. So
yeah,
we need to be careful when we start buying buses that they are full. Okay, I'm sorry.
Okay, so we'll just expect some of those calendars next month. Okay, discussion item G, IMB, IMB-R, and EBCE.
On this IMB,
Yeah.
Controlling
do we
this
have-
conversation, I'm sorry. Last time, it was said that the sentence removed, although teachers have the right to express personal viewpoints and opinions, they do not have the right to indoctrinate students to their views. I thought that we had asked to have that struck. I don't know.
We did.
So if somebody can chime in on that.
I thought I remembered that we were just gonna because it's not on here as a first read it's more of a discussion.
Right.
That we were going to discuss it and figure out what more changes maybe might need to be made to bring it back for a first reading is the way I understood it.
You guys were gonna provide the changes, because there was multiple paragraphs that you all were not.
There was two changes. There were two changes and I understood that it had been okay and that's what we were gonna do. So we can take a listen.
Well, there's, because I've even found some inconsistencies with IMB-R with the IMB, as far as like the G-rated, PG-13, things like that, that it's like, well, this doesn't match in with this one. I know we were talked about where it says the principal may instruct the teacher to notify student parents, guardians to obtain permission slips. And I said that we should change that to will.
Right.
Instead of giving them the option to maybe or maybe not do it. I think that's, I think that was one of the problems with our mill levy as well. The word.
I agree with that. We were also gonna put in the IMB that there had to be a permission slip from the parents for any movie that was being shown.
Yeah, it says the principal will also determine whether parental permission should be obtained. And I think that should be given.
Oh, you're in the R.
It's on the R. It's under guidance for principals, number 2. Because I'm thinking if it's anything controversial, automatically it should be obtained. Just to cover any issues.
So you wanted to read how? The principal will,
however we
says permission should be obtained.
Well, I don't know if this is it should be a guideline for the principal or the principal will. And I don't know if reading this, if it's the principal or the teacher that's actually sending out the permission slip.
It should be the teacher.
Yeah. So the principal will direct the parent, the teacher to obtain parent permission slips. I mean, we just need to state it to where it's actually done and not decided on whether it should or should not be.
So you're talking about under guidelines for principals.
Number 2.
And how do you want that to read?
Kind of just along the lines, the principal will direct the
principal will direct teachers to obtain parental permission slips. Right? That what?
Yeah.
Do we know?
And I still think the IMB should be changed.
Okay.
Oh, yeah, we got several, yeah.
So
if we stop IMB first. So we started with IMB first. I just had that
one.
Will in the about a third of the way down, and may would be changed to will.
Where's the may and the will?
It is on IMB, the second page. Let me see here. These are back and forth. It's on 2 of 2 of IMB. And it's about halfway down, the third, not quite halfway, it says the principal may instruct the teacher to notify students, parents, guardians.
Oh, yeah.
And obtain.
We just cross out may.
Yeah, and
say
put
will.
will. The principal will.
Instruct.
I see teacher, I don't see principal.
It's
And then the wording on just a little further down, about halfway, it says when teaching about controversial issues,
Okay, I got it.
teachers may express their personal viewpoints and opinions. And that's almost like, are we giving consent that they may go ahead and express their personal views and opinions, or they might? So I'm thinking if we were to put teachers might express their personal viewpoints and opinions, however, they also have the obligation to be as objective as possible and impartial.
I think that you better take out as possible and say,
Yeah, just be object.
yeah, I'm sorry, you're leaving, that's a lot of leeway.
Yep.
Well,
They have the obligation to be objective and impartial.
Mm-hmm.
And where are you at now?
About halfway on page 2 of 2. It's a beginning sentence, when teaching about controversial issues.
When teaching
about-
about controversial issues.
4
teachers
sentences
may
down from
express
the will and may,
their,
Deb.
Personal viewpoint.
So out of curiosity, what's controversial issues?
That's some,
It's defined right here as explicit sexual conduct,
mhm.
graphic violence, profanity, drug use, or all other socially undesirable behaviors. And now you can't have an opinion on that, so I can't say cussing is bad or I'm breaking policy.
You're right, but I'm just,
It-
I also know of teachers who have been very explicit
So
in how to,
then I almost think we need to define it a little bit better on what we're not wanting in there. Just because I think taking away any,
well, I think that we should, I mean, personally, I think that you just need to take out teachers may express personal viewpoints and opinions
on controversial subjects
on controversial.
such as profanity.
About controversial issues.
But again, what is controversial?
Well, it's defined right
Sexual,
here.
It's on-
sexuality.
It's on here.
Religion.
It's on here.
All of them.
Controversial materials are defined as learning.
Politics.
Stacy, it's right here.
Graphic.
Controversial materials are defined as learning resources which are not part of the district's approved learning resources and which are subject to disagreement as the appropriateness because they refer or relate to a controversial issue or present material in a manner which is itself controversial. It's already defined. That's on the first page.
But it's saying not limited to sexual conduct, graphic violence, profanity, drug use, or other socially undesirable behaviors. Materials are likely to divide the community
Right.
along racial, ethnic, and religious lines.
I have a concern when we say, and this is coming from a teacher. Because when I taught, I was so careful to never give my opinion in the classroom. I did not say, this is a really tough test. You guys all need to pray. No, that's controversial. I'd say this is a really tough test. I hope you all studied. You just do not approach controversial subjects in the classroom. I'm sorry, it's just, unless you're in a health class, and that's the curriculum and the synopsis. But otherwise, I do not believe that it is a teacher's right to give a child their viewpoint, whether it's weird or whether it's wonderful. It's just not a teacher's right. Avery, share with us.
I have some pretty amazing teachers, so I've never felt like they've been like forcing their opinions on us. So I don't know how much of a say I necessarily have in this. I just can say that in school, I've never felt like a teacher is like pushing their opinions or their viewpoints or anything on me. But I also have really great teachers.
So and I'm glad you said that because we have some phenomenal teachers. Okay.
So how much of that sentence are you uncomfortable with? I've got it marked at the beginning of when teaching about controversial issues. How much of that, how far are you not in agreement with that statement?
I would say when teaching about controversial issues, they have the obligation to be objective and impartial to present fairly the various several sides of an issue.
So it's the middle of the sentence.
Because I don't really care what the teacher's personal views are. They need facts. We need to stick to the facts. We need to teach facts, not opinions. I say that all the time.
I think that even goes for non-controversial in some ways.
Yeah. Well, yeah, it should go for it.
Not even controversial.
And not even controversial.
So you're saying
Down
remove
to the
teachers may
although,
express all the way
not
down
included
to possible and?
Yeah, and then you need to take out all the teachers have the right to express personal viewpoints.
Well, when teaching about controversial issues, right, yeah. So we start from teachers and go all the way down. When teaching about controversial issues, they are to be impartial to present fairly the various several sides. Is that how you're reading
I
that?
say, when teaching controversial issues, they
Teachers.
have the obligation to be objective and impartially to present fairly the various sides of an issue. And then the next sentence I crossed off and said controversial issues are to be presented with good judgment and coordination with the building principal, keeping in mind the maturity and background of the students. And that way, it can be presented, but the teacher has no opinion. It's just black and white. This is the way it is. You know, you draw your own conclusion. This is what drugs do to you. Personally, I think that it's horrible. No, you don't say that. This is what drugs do to you. You determine, are you going to do drugs or are you not? Alcohol makes you crazy. Are you going to drink alcohol or not? It's your opinion. It's not mine. See what I'm saying?
This also means presenting both sides of the issue.
I'm sorry?
Make sure you understand this both means presenting both sides of the issue. It's not always black and white like that. You're talking government, when you're talking science, when you're talking interpretation of literature, you have to present both sides of that.
Right.
But again, it's not just the facts, it's also.
But it's not an opinion. It's giving you the facts. It's giving you each side. There's facts on each side.
Okay, it's not just one fact.
It's not just one fact. But it's, you give them the whole story, but you keep your personal opinion out of it. You know, personally, I believe that, I'm trying to find something that's really controversial with it. I believe that everybody who wears a mask for COVID is stupid. Well, that's not true. I mean, I wear a mask a lot of times. Masks are very important to protect you if you have a cold. Masks have been known to not protect you completely. You're given two sides.
We have to remember, we're just talking about the controversial stuff.
Right.
We're talking about science as far as now.
And
you know,
math, if
the,
that's.
there's certain
history.
things that is
Yeah.
part of the educational process, but if we're bringing in controversial stuff that most parents don't even want talked about at school, let alone watching it.
I think that's a challenge though, because what's interpreted as controversial can be so.
Right.
It is.
It can be controversial on ag. If I use Angus as an example and you're a Hereford
yeah.
person.
Yeah.
That is true. That is true. It's a fine line.
Sounds like it's straight up right.
Talk GMOs in class and how many parents you get rising up for you.
I think, and one of the reasons that I feel so strongly about this is because we have passed a resolution to not teach CRT. If we don't curtail it, then we're leaving ourselves open. I'm just throwing it out there. I look at things because I'm a language arts teacher and literature. I look at things differently. There's not a right and wrong answer in literature. There's an opinion, but we have to be careful when we voice an opinion.
Are those changes, if I brought back those changes for the first reading at January 18th, would that make everyone comfortable with the policy?
Well, I just had a couple more things, sorry.
But now's our time to.
Yep. So on page 1 of 4, and this is just, I was going to bring this and see what everybody else thought, but it says the teacher may make this initial presentation verbally. However, the principal may, in his or her discretion, require the teacher to submit a written proposal for the use of the resource. I was thinking that it should probably always be in written form. And then there could be a verbal discussion about it, just so you have it on file.
To say that's covering the principal.
Yeah, just so you have it on,
Yeah.
so it's not like a he said, she said, or a,
Yeah.
I thought you meant, or, you know, I don't know, but I'm just saying, a lot of times a written
That's
document is a
taken care
little
of the
more
principal
binding
for when a
than.
parent comes in screaming.
I mean, to you,
That's a lot of work for what defines controversy.
Yeah,
I mean, every single subject in every single class has something that could be controversial. So
I agree.
there's not a single class at the high school that I wouldn't have to have something written multiple times. Maybe even that.
So would you be comfortable?
Or it should be. Yeah, everything else is.
So you're comfortable with not having it in written form?
Okay.
Okay, because this is for you. It's not for us.
How often do you have teachers coming to you?
About this,
Yeah, to get approval for,
we don't, I mean, not very often because we kind of have a set of what the curriculum is.
Okay.
It's always good, as you've heard about how we present it, so
or it's already been approved?
it's already been, and, you know, there's always disagreements like with parents, if they don't like something, that doesn't mean that it's gonna be changed.
Yeah,
As long as it's presented.
they just give them something different, yeah.
Then it's up to the student to make a decision on what to do.
So is it, I guess, easier to say that we have less issues with this policy than we do have issues with it? I mean, like, it's like, should we just, it's easier to take care of the issues that may arise than it is to change parts of the policy.
So you don't want to change any of that we've talked about?
I would still say that, I still think there should be a parent permission slip.
Okay.
I still agree with that.
I
And that
still
we need to change.
I still think that we
Because the question
viewpoints.
That is for what? Because if you have the guidelines set for the, if it's a movie that's being shown, and there's some guidelines on PG-13, that kind of stuff.
Right.
Why would we need the
Oh.
provisions that we've already accomplished with the recommendations set forth?
Well, that leads us to page 2, where it talks about PG-rated films and videos shall be considered controversial in the elementary school level, but it doesn't say anything about PG-13 or R. So when, I mean, I know, but that's what it says in this policy. So that's why I wanted to add PG-13 and R to the elementary level, PG and R to the mid-school level.
It does.
No, it says it in the first page.
Page 2, 4 of IMB-R.
Page 2,
number 2.
2, if you go all the way down.
PG-rated films and videos shall be considered controversial at the elementary school level. PG-13 rated films and videos shall be considered controversial at the middle school and high school.
No, mine does not say that. Mine says PG-rated films and videos shall be considered controversial at the elementary level.
PG-13 rated films and videos? Go ahead, Mr. Lehman.
Just to let you guys know that if we had a reward movie for the kids, Frozen
is PG.
Is PG.
Yeah.
So it's controversial. So we would need some sort of permission slip for the kids to see that. So I just want to let you guys know that some of the movies that you think that are, oh, this is a great kids movie, are PG.
Right.
Oh, there's plenty out there that.
But this is actually already in policy. We're not changing it. It's already in policy.
Well, one of the challenges that is too, is there's a lot of educational films that come with curriculum now that are not rated by that kind of a system that could be considered highly controversial. So
Okay.
So we probably need to add some of
TV
those.
14 and stuff like that. Well, even, I don't even think it has the TV ratings. It's just considered.
Not
educational
rated.
content.
So then you should.
They just need a permission slip?
I still think you should.
Yeah, that's what I mean. Is that, does that need to be our only change?
So answer this, at the beginning of the year, when you send out your syllabus and all of that, the curriculum, do the teachers not know what movies they're going to be showing for the whole year? Or basically, not always.
I would say particularly now with the turnover of staff that we have, I would say definitely not.
Well, that's true too.
It's not where we used to have teachers that are, 30 years in the classroom, they've got everything scripted.
Yeah, I used to show Tom Sawyer. I can't show that anymore.
Because I was
That was
thinking that permission slip could have all the movies that will be shown. And they could sign that at the beginning of the year. You're covered for the year.
Right. So I think that in some cases where you have to sign a waiver if you do not want your child's photograph used anywhere, and that covers you through the whole year, that maybe it could be similar.
Well, I think a great practice is exactly what you said. And, there have been times when we've developed like pacing calendars that identify the movies just because you want to make sure that kindergarten teachers aren't showing the same movies as first grade teachers aren't showing the same movies. You kind of want to scaffold it as they go through the system. But to Drew's point is, we have so many long-term subs in right now that are working their tails off, but might not necessarily have the same scope of what our, long-term teachers have had. And we've had so much movement of our workforce this year where some of our even our younger teachers who are really dynamic, they've been trying to teach classes that they're not qualified to teach or to fill in, as well as our administration has been doing that. So that consistency and flow that might have been here a couple of years ago, we're looking to recapture, but it's not there right now to all degrees.
Okay. I still would like to have on page 2 of 2, personal viewpoints and opinions scratched. Okay. Other than that, I'm okay.
We about discussed that one to death?
Yeah.
Okay.
Cross out that as possible. As possible, cross that one out.
What's this poster?
Oh, okay.
Yes.
Did we have any changes on the EBCE that
I liked what you sent out.
that I sent out for you to thoughts and ideas or changes or?
I liked it. I have no changes. Yeah.
My only challenge with EBCE is there are times that school closings or cancellations, there are times that first responders might not be there. And so that's one of my challenges. And then if it's a closure, that does not include a late start for snow. Because I am making that determination quite early in the morning, and I know that I got in touch with you guys
And that's,
last
this is
time.
not,
but-
so you are allowed to make that determination.
Yeah.
To close for.
It says right here for weather.
Because I just saw that it said, emergencies which warrant.
So if you have a fire in the school, please call the fire department first. Like, please do not call me.
Well, call me, but after you get the,
but.
yeah, or you have an active shooter, you want the police there.
Right. Well, and I just want to make sure, I'm just leery, and I don't mean leery in a negative way, like leery sounds kind of creepy, actually, but just the warrant a call to first responders, so I just want to make sure that if, whether it be, sometimes it's due to insects or, things where you might not be calling a first responder or the police, and so there's certain emergencies that just, I can't even think of one right now, but.
Batson.
We're all beating ourselves, aren't we?
They never shut the school down for us for bats.
Oh, they did, they shut the school down for that.
That's my classroom when I was teaching. So.
And I understand, I'm not being, I'm just leery of just the term first responders, just because there are sometimes that the first responders aren't there. And I want to make sure that what do I do? Like, what if I can't get in touch with you? What if I call you and it's?
Well, we have a safety protocol in place. If there is a fire, you need to there's the fire bell that goes off and you practice you're getting out of the school.
Right.
And you're calling the fire department.
Yeah, but those are first responders.
That's what you are allowed to do that.
I'm just saying there are situations where first responders
aren't needed.
They're not needed, but there's still an emergency.
So if you have a bat in this classroom, let's evacuate that classroom, whatever we need to do. And then if it comes down to you need to evacuate the whole school.
Or Or close it. I mean, I'm just saying that
But that's when, if it's a bad issue or something like that, then call the president and say, hey, we
I'm
have a
shutting the
bad
school down
issue.
because we've got
I need to
that
close
issue.
down the school. I mean, I can't think of any time that you need to close down the school that you would not have time to call the board president or first responders.
I'm.
Well, and it may be at a school level, it may be, you know, Ms.
Well,
Nelson's
right.
call or,
Yeah.
you know.
Well,
somebody
no,
else's
many
call
times
to-
it is just at a school level, and my concern is, I'm just concerned with the term first responder, so I apologize, because there are times that the first responders don't come. That they're not.
Okay, any other emergencies that would warrant a call to first responders if the safety, health, and welfare of students or staff members is threatened? If you need to call a first responder, please do so. If you do not need to,
Then you call Sherry or the president, whoever the president is.
I'd put in after first responders and or law enforcement too, or something.
First responder or law.
well, I kind of thought that would be kind of the same thing.
Yeah.
As far as,
Not really, but,
you know,
but
Or law enforcement.
fire, ambulance,
safety and,
police.
I mean, those are, I don't know. Those are just no brainers.
I like it. So-
I agree with Ed. I think if you're gonna put first responders, you need to put and or law enforcement.
Yeah.
Okay, that's fine. Yeah.
Got her done.
And put and or,
law.
because sometimes it may need both. Okay.
So it says dismiss them early in the event of hazardous weather or other emergencies which would warrant a call to first responders.
And or law enforcement.
So even when I call snow, for example, it says there that I would have to call a first responder.
No, it means, it says that you,
Or other emergencies.
or, you've got the little word or.
Which would.
Power to close the schools to dismiss them early in the event of hazardous weather or other emergencies, which would warrant a call to a first responder and or law enforcement.
Okay.
If the safety, health, and or welfare of student or staff members is threatened.
Right. Then you call.
So
the
if you were to
school board
say, you know
president.
what, we didn't take off Veterans Day, I'm going to close the schools. So you would call and say, Sherry, we have enough days. I am going to call it, we're going to shut this district down for Veterans Day. That's when I would want to call, going, why are you shutting down the school? You know, something like that. And then we get down to the part as far as like the public health emergencies. That's a whole nother
That's a whole nother
paragraph.
paragraph.
But I mean, if the school is flooding, by all means, please call maintenance and
whoever
have that, you know, whoever the custodian, you know, I mean, it's, like I said, this was warranted because I felt it like it was abused, and now that's why we're bringing it back. And so, so this is where we're at.
I like it. I think it needs to come back to first reading.
Do you want to talk about the other?
Or law enforcement, we need to add that.
Okay.
But the rest of it, I read it yesterday, so.
Just a small thing. I think emergency needs to be changed to special.
Where
An
we're at?
emergency. Under revised July 28, 2020, it wasn't officially an emergency meeting. It was like.
Well, this was
Yeah.
last year.
Yeah, we can't take emergency off because it was last year.
We did have it, and that was to give emergency powers. Which
Yeah, I'm talking about that. We had the emergency board meeting, right?
Mm-hmm.
But I don't think it's officially, technically is an emergency board meeting.
This was in 2020.
Last year in 2020.
That was in 2020, not 2021.
This policy was
Is that what you're talking about?
revised.
Yeah, he says, never mind.
Never mind. I know we had gotten that mixed up before, whereas.
No, that's
Yeah.
totally fine.
It's getting late. We're all getting foggy.
No, I just didn't know that.
Okay.
Yeah. All the years are running together.
Okay. Any other discussion on that? No? Okay. Okay, discussion item H, the retreat update. And this is basically just to remind everybody when the retreat is, which is going to be January 14th, I believe from 1 to 5 at First
1 to
National
5?
Bank. I think, does it say 1 to 5?
Yeah. Can you do that, Lane?
Yeah, but she's off that.
Yeah.
So, yeah.
You're off that.
Thank you.
Are we supposed to give you things over?
You can bring your discussion items. We were hoping, and I think then on Saturday from 8 to 5, I believe we have the building.
Yeah.
And we were thinking about possibly just pizza from Domino's across the street.
Mhm.
Just have them deliver something if that.
And then
was.
we
okay
were
with
going to
everybody.
have like
Salads or.
Cindy
pizza.
come in and give us an update on insurance on Saturday.
Mhm.
And
be here,
it's First National.
First National.
Yeah, First National Bank.
And then Kyle on the budget.
Well, and I wanted to clarify as well what your expectations were, because I had a conversation where the expectation might have been from 1 to 5, we would bring the directors in and the executive directors to share our story of our district, so that all the new board members can get a clear picture of like transportation, what's our fleet, how many buses do we have, how many vehicles do we have, how many miles are on each vehicle, how many transportation drivers do we have, and that for every department. And then, then I was hoping that we could strategic plan more on the 15th, but I wasn't sure, because one of the conversations I had was, it was thought that the board would just meet together. And for me, without me there, and for me, this is a very collaborative thing where I feel I've never been left out of a retreat. And so it is a public meeting, so I could go sit in there and listen.
Good.
But I want to make sure that your expectation is what I'm planning for.
Well, I thought
That
that
makes
Friday was for you to give us all the information you wanted, and then Saturday we were going, you're supposed to be giving us something on Robert's rules.
Yeah, just kind of.
And I mean, we're just kind of, we're doing a board retreat on how to be a board.
Right.
But what is a strategic plan that you're wanting to do?
Well, so the goal is to look at the strategic plan. So we had a strategic plan for 2019 to 2022. And I mean, 2021. So it just expired. So as I look forward to looking at what we're going to do in the next 3 to 5 years, I want your feedback based off of some of the data we're going to demonstrate on a direction that you might want to go. And I don't need the answer on the 15th, but I don't want to create a strategic plan unless you direct me to, in a sense, with my executive directors and my staff and administrators, and then I come back and demonstrate it or showcase it to you, and you're like, no, we don't want to do that. And so I want to give you some nuts and bolts on what we're thinking about for the future.
Can you schedule her in sometime Saturday? Say, we've got that meeting at 8 o'clock with Brad Miller, and then have Cindy come in at 10.
What time?
10? Is that okay?
The insurance information.
For the insurance, how much time do you need?
No more, definitely no more than an hour.
And then
That might even.
Kyle could come in at 11 then.
What do you want? Can we do all them on Friday? Or not?
No, this is on Saturday.
And I'm saying do them on Friday, so they're not taking up their Saturday. For this.
Mhm. We could do, well, except that Risha's got her Friday planned. She's got Friday planned for us. And what she's
The whole
wanting to
time?
do.
That what?
What, I said, he said, can't we do it on Friday so that they don't have to come in on Saturday? And I said, but you've already got your Friday, you've got our Friday planned, right?
Well, the Friday includes the executive directors.
Okay.
So the Fridays includes the executive directors unless you want a different specific thing for Saturday. But the goal was that we would have our executive directors showcase their story, and then each executive director oversees some different directors. So the executive director would speak, and then the people that they oversee would speak to share their story of like our nutrition,
It'd be really short for you, won't it? You have no one.
She oversees transportation.
Yeah, she does transportation.
Oh, okay.
Yeah.
I was going, man, you've got it really short when you oversee yourself.
So, the goal was to create a complete package of just a story, because I don't know, I'm sure the board members who have been here for quite some time have had a great story shared about this district, because there's a lot of great things that we're doing and each department excels in different ways. But we do have 3 new people that I really want to share our story and showcase and give you a picture of where we are, like, where are we today? What are our strengths? What are our challenges? All the directors and executive directors already know that they're presenting.
Okay.
And so this was shared a couple weeks ago with them. And I gave them the template. And so, each director is charged with the maximum of 20-minute. And then after, like, let's say, Mr. Parr's demonstration, then it's the time for you guys to ask questions, although you can ask questions at any time. We just want to show this is where we are. And then as we move forward, what direction do you want me to go? We'll be talking about consolidation, and we will be showcasing, we've been meeting in regards to numbers, enrollment numbers, staffing numbers versus enrollment. And so there's, I want to know, I know we did have we have 3 new board members. So I want to know if you still want me to focus on, consolidation or not. And if you do, I will strive forward. But I just want to have a conversation because I don't want to guess what you want from me. So that's what I was.
So if you have Friday set up with our directors to come in, I think that would be sufficient unless they have more that they'd like to share and want to come in on a Saturday. It's completely up to them.
And if you want specifically, I could have HR come in just for the insurance piece to dive more deeply on that Saturday. But
I hate for her to have to do that, but I think that's
I think it's really important.
We really need to know that. Yeah. Okay. I think that's a really
Was
important
there something
aspect.
specific we needed from Kyle?
I think we need the
Kyle was gonna
consolidation.
set the
stuff.
Word docs demo at some point during the retreat. We don't have that.
I don't have that as well. I pushed that one off because if you need to set it up with the boards and the timing, that has to come from you. I'm not gonna reach out.
Oh, okay, I'm sorry. Thought that was fine.
And the board docs.
It's not pushing it off, it's delegating.
Do we want to?
we'll circle back around with that.
Yeah, because that's a lot of money.
Okay.
So Kyle is gonna address the consolidation and that kind of stuff in his presentation on Friday, is that?
Well, it's that the consolidation is kind of a combination of many different pieces. So I might be the one presenting it with backups, because we've been meeting as kind of a tripod, the 3 of us, and having this discussion. And so.
Yeah. And again, I hate for Kyle to have to come in. I know how
I am not.
on Saturday.
Yeah, if needed, I'm okay.
And if we can do it by Friday, I will make every effort to do what I can if I can keep someone home with their family. But, I'm just beginning to build I'm meeting with our directors and our admin teams tomorrow. So not administrators.
So.
Don't worry. Yeah. I gave them this week off because it's the beginning and it's a short week, so this week.
I think we do, because I don't think we have Ed discussing, and then people are gonna bring some ideas that they want to bring forward, and you see where we're at right now, we started at 7:00, and so we just had a few things.
So I said, do we need a whole day, but yeah.
What's that?
I have all of mine right there already.
Okay, good. So we are gonna need all day Saturday.
And the first thing on there is this one.
Yeah,
Had it on there for weeks.
we need to make a phone call. I'll do something. Okay. So what
Okay.
time do we go on Saturday? 8:00?
Saturday, we have it from 8 to 5, I
8 to
believe.
5.
Right, Deborah? Yeah, 8 to 5.
Okay.
And I guess if we are done early, I mean, I don't think we have any issues with leaving at 3 or
Mhm.
Yeah,
anything like
I'd
that.
like that.
So. Okay, now the fun part. The board evaluation. Where did I put it?
You guys can go if you want to, but you're more than welcome to stay and hear us criticize ourselves. Avery, you can, you don't need to stay, but if you want to hear us talk about ourselves, that's great.
Oh, great, I can go.
Okay, so you all should have gotten a 2-page evaluation questionnaire, basically Board of Education evaluation questionnaire.
Yeah.
With, gosh, how many questions? 19 questions to evaluate ourselves 1 through 5. 1 being unaware. My knowledge is too limited to respond at this time. 2 being a seldom, have I seen this behavior or sensed this attitude? 3, sometimes I have seen this behavior or sensed this attitude. 4 is often have I seen this behavior or sensed this attitude? And 5, consistently have I seen this behavior or sensed this attitude? So you were to rate how you thought the board was on information, orientation, policies, policy implementation, proper role, staff relationships, conflict resolution, openness, decorum, preparation, representation, feedback, mutual respect, delegation, evaluation, fairness, conflict of interest, individuality, and priorities. So is everybody able to complete that? Okay. We want to start with each of us, maybe starting with 1, and yeah, I'm going down the line, just kind of talking about each one. Maybe we want to start, Cody, come start with you, down there with number 1.
Do you really want to?
Well, I can start with Lane down there at the very other end. I decided to go there. Go ahead, Cindy.
Can I ask a question?
Yeah, absolutely.
Is this supposed to be done publicly?
Yes,
This is.
has to be done publicly.
The board specifically. Yeah.
I apologize. For
Yeah.
I just wanted to make sure.
Oh,
Her HR's coming out.
I've always been told that we had to do our board evaluation in public. So,
but now if you know something different,
Well, yeah.
We would be sure to adjourn.
Yeah.
You know if that's documented, or you've just been told that.
since I've been on the board, 18 years, we've always done it publicly. No, I don't know if it's documented or not. I don't know.
Yeah.
I know that the superintendent's evaluation
You
needs
think
to
we
be
should
an
not?
executive order.
we should call.
I want to know.
Yeah.
One thing that I might recommend,
This way last year, we turned them in.
one.
Yeah, but, and then Phyllis compiled it.
Yeah.
And it was just compiled and we didn't turn it in this year.
Well, and that's one thing that I would recommend is what I have seen is you fill this out and then we collect it. Deb gets everything.
HR, when it comes to evaluation.
Everything put down, and then the next board meeting, we have it so that we state what you as a group of 7 have, what is the average? And then it's a private document, but your own document is private, but it goes public as a whole. Because it even says here, I didn't realize we were gonna fill it out and discuss it here right now, so I apologize. You are evaluating the board as a whole, not individual members.
Right.
And so that would be my recommendation. I didn't mean to interrupt you, Ms. Ray.
No. I was just making a statement, so I don't care how we do it.
So would you like me to adjourn the meeting and then we have this compiled, or?
Well, we could compile it and give it to you, have the results ready tomorrow-ish.
That's, we don't need it tomorrow. We need it for our next board meeting.
Well, can we have it for at least our work session?
Board retreat.
Yeah, we do it during the board retreat.
I mean, I'm not a work session, but I meant.
That would be a perfect place to do it, I think.
Yeah.
Okay.
I mean, it would give us a lot of direction on where we need to go as far as being a better.
Gives us
So
the
if we want to turn
discussion.
these into you, you can compile those, or?
Do you want to compile those by just our names and stuff so that we know
Yeah.
where we stood,
Yeah,
what the rest of the
generally
things and stuff do, or?
You what? I'm sorry.
I'm sorry. Yeah.
When she puts that together and stuff, do you want to compile it by each person here so that we know, like if I marked one at a 3, but everybody else marked it at a 5, did I know that, or?
Always before, we've just compiled it like, if I said policies is number 5 and Jeanette said policies is number 3, then it would come across as 4.
Yeah, but I'm saying do we want to know?
Should you put your name on it?
Yeah.
Doesn't matter to me. I
Doesn't
have
matter to
nothing
me.
to hide about the
Yeah.
board.
Well, that sounds like though something that you might have during your discussion, right? After it's all compiled,
Yeah.
and then you'll all have your own individual evaluations and still be able to start your discussion there and say, this is what the average was, but this might be my position and so what?
I like that idea.
Yeah.
Okay.
And one more thing before you adjourn is I did add this to your packet, which we just received. And this is from our attorneys that they're, as of January 1, 2022, there will be an increase of rates by 4%. And so I just wanted you to understand this because these are the people that I call all the time.
Okay, so is this like the board attorney or your attorney?
This is not my attorney. I do not have, the attorney that I use is the attorney that represents the board and the organization. They do not represent Risha or the superintendent. They just give me advice and guidance for running the district.
Okay.
Yeah, Kristen told me that many times. I represent the board now.
Okay.
I represent the school district.
Yeah. I just wanted you to recognize this.
I guess we're turning them in. Who gets them?
Well, I'd like to,
you want to make a copy? So take it home and just get it to.
Are we gonna put our names on it and then you'll give these back to us to talk? Or compile them? You'll compile them and then give these back to us?
If that's
have the results.
If that's what you would like.
But if you want to take it home and copy it.
Okay.
That's
we can scan it here too. Okay. If you would like, before on our way out, I can scan anything or copy it or whatever you would like.
Mine's Staples, so I'll just take mine home.
So I'm good.
You all have it electronically, because it's in your packet, you received it.
No.
Because there is a policy, evaluation of board and board is self-evaluation.
What does it say?
Mine's scanned.
The board shall establish objectives related to board procedures and relationships and shall periodically measure its performance against the stated objective through a self-evaluation process. The following areas of board operations and relationships are representative of those in which objectives may be set and progress appraised. Board member orientation and continuing development, board meetings, fiscal management, board community relations and communications, board superintendent relations, instructional management, planning and goal setting, board staff relations, legislative leadership, and policy making. This was adopted October 23rd, 1990, and reviewed October 4th, 2011. It is board policy BAA. But under, nowhere does it say that this should be done in public forum.
Or either way, it doesn't state either way.
Either way, we can or can't.
Okay.
You know, we used to always be requested to write down board goals.
Well, I think, well, and you know, since we have 3 new members, because we do have our goals, missions, and
That's for
that's the superintendent. But didn't we have some for the board as well at that same time?
I don't remember.
Okay, so,
It says policy making.
okay,
So
so maybe we could have everybody
Take these
bring
home and bring it back.
2 or 3 goals to the retreat. Can we go over this? 2 or 3 goals for the board?
So we're gonna give these to Deborah.
That's what I was
We're gonna
told.
Get there to Deborah, and she's gonna compile them, and we'll get these back, or we'll keep a copy of
You
it.
keep your own copy.
And then we'll discuss these at the retreat. Is that the?
Yes, and if you would like me to make a copy, I can make a copy as we go out.
I guess. not.
Anything else?
Right.
Anybody?
I'm sorry.
One thing, one thing. Congratulations to this young lady.
Oh, yeah.
Yes.
For signing
Yes.
Colorado School Line. She's gonna run track there. And
Yes,
she's gonna get a
congratulations.
great
Yeah.
education.
I was going to wait until our next meeting, so
Ah,
the room was full.
Yes,
She's
so.
done a great job.
Yes, congratulations.
Can you put for an action item next, at our next meeting, a PV secretary?
What?
PV secretary. I think that we're doing our kids and our teachers a disservice by making them multitask. So at least a part-time one. We've got to get, we cannot let our kids go by the wayside, even if there's only 30. Okay.
I adjourned this meeting at 10:35. Like that clock on the wall.